So Tom, if you could please.
So what you just heard about, I'll take you back to where you were in the beautifully sculpted narrative. Kate had just said you're going to hear a range of amazing presentations today, thinking about discovering new career paths and how to action those. One of the tools that you can use there is your case and their case, knowledge, attributes, skills and experience. What do those people that you're hearing about have? What do you have and what do you need to develop in order to get to where you want to go? In the context of all of that, I was introducing this idea, the Concordat, to support the career development of researchers. And in the Centre for Research Staff Development, this is something that we work with very closely. I'm not going to go into too much detail, but highlighting in that blue box the key principle, King's has publicly committed to you having 10 days pro rata per year to engage with professional development. So when you're thinking about building your case, developing that case, you've got 10 days per year in which to do that if you can find a good use of that time. People do often ask me, well, Tom, 10 days, what does that actually mean? So one of the things that it might mean is a unit of time. It could be 2 weeks, it could be the 10 days, it could be 20 half days, it could be 70 hours. But the point is that you've got that time to play with and to use in the way that best serves you. Some of the things that you could use to fill that time are on the screen here. So professional development is a broad church. It means a range of things. But what my challenge to you is to find something that works for you. So find something that helps you develop that case in the direction you want to develop it and start to colour in those boxes until that 10 days is fully used up. So it's a kind of use it or lose it principle. So you might go on courses and workshops and they can be the 1 hour, fit it in your lunch break. It could be a really kind of intensive course. You could go off for an entire day, 2 days, 10 days, whatever it might be. There's one-to-one avenues, so there's mentoring, there's coaching, self-directed learning. You can dip into that whenever you need to. You might just do 20 minutes here, colour in a third of a box, and then another 20 minutes there, colour in the next third. You might spend time with our wonderful, wonderful careers consultants, and you can book through King's Career Connect. Kate? You might self-reflect. You might sit there and think, I'm just going to spend an hour thinking about my case and writing on conferences, seminars, reading groups, going on a committee. Range of things you can do. Think about how you're using this time to best serve you to make sure that you are using that 10 days allocation. Having said that you can work with our wonderful careers consultants, here they are. Kate.
Thank you very much indeed. So there are 4 of us that work with researchers across King's. I'm the person that works specifically with you at the IoPPN. So you are most welcome to find me out if you would like to. I've worked with IoPPN researchers for, I slightly dread to think, but maybe 8 years. So I've met a lot of you over the time. I've heard your stories. I know what's going on for a lot of you. And I'm not an expert in your areas of science, but I am an expert in how you move on. So please, right now, follow us on Twitter. Find us on LinkedIn. So start with me. You've got my name on the screen there. Find me on LinkedIn. It'd be lovely to connect with you. I've got a great network of IoPPN alumni that you can have a look through my connections and see what your peers have gone on to do. And if you're a podcast kind of a person, then you might like to subscribe to Careers in Your Ears, which is dedicated podcast for researchers from our team, all sorts of case studies and interesting discussions on Careers in Your Ears. The one that I most recently recorded was with Professor Sir Simon Wesley from the IoPPN, talking about researchers and mental health and the kinds of things that institutions need to do and individuals might like to do in order to better support their mental health. So that's who we are. We really acknowledge it's not a great diversity in our team. If you think there's something we should be doing differently to amplify diverse voices, please get in touch and we will absolutely do what we can do. So the support for researchers, what is it that I can stand here and or sit here and offer to you? Mainly the key thing that people most generally access through us, most immediately helpful perhaps, are the one-to-one appointments. So it's either 30 minutes or an hour. You can come and talk to me or one of my 3 colleagues, and when you log into Career Connect, you'll see PhD and research staff appointments. You'll be able to book with one of us, and we can talk about anything that's helpful for you to talk about. I think the really key thing about us is that we are impartial. I'm not your manager, I'm not your friends, I'm not anybody in your family. I haven't heard your story before, unlike perhaps some of those people. I can keep what we talk about confidential. It's tailored to where you are in your career thinking. So that discover, focus, action framework, it's tailored to you there. And you've got on the screen there some of the feedback that we've got for people, from people that we have met before. So some of that's the appointments. Some of the other things that we can do are career events. So the first one up there about race and identity in research careers, that one has passed, but I kept it on my slide because I wanted to remind you partly that we've done that event, but also that our events are recorded and you can find them on our Keats page. And I'll find a way to make sure that Despina's got all the links for these things. One coming up on Friday, you need to book through Skills Forge, not Career Connect, is about recruitment. If you're going to be a manager or you perhaps are a very early stage manager, got a short introduction to how you might think about recruitment. And then 2 more events coming up you can see on the screen, which actually complement what we're doing today in terms of opening up your ideas to the kinds of jobs that you might want to go and do in the future. And they are bookable through Career Connect. Really exciting. Both of those will be bringing back King's alumni. So those are the sorts of things that we can do to help you. It's the one-to-one appointments, it's the events, it's also a lot of advocacy. We really support you through the work that we do through the various committees and papers and things that we write for Tom's team within King's.
Great, and so just to kind of close out before we've got, it looks like maybe 7 or 8 minutes for questions. You've heard from Kate, you know what that team is and how to get in touch. So just for us in the Centre for Research Staff Development, you can email us on research-staff@kcl.ac.uk. That's the shared mailbox. We'll get you through to a member of the team. You can email me directly, tom.rusbridge@kcl.ac.uk. You'll find details of our offer at the internal pages, internal.kcl.ac.uk/CRSD, Charlie Romeo Sierra Delta. What we offer on there is courses. We have a program of professional development courses running throughout the year. You can find the details on those pages, but you need to go onto Skills Forge to book, training.kcl.ac.uk. If you go onto our internal pages, you can also find details of our one-to-one offer. We operate a mentoring platform that is open to you to sign up now. We offer coaching that's open to you to sign up for the waiting list now. And there's also signposting there to the resources from Kate's team as well. So if any of those links, you're struggling to write them down, they're all compiled for you on those internal pages, as well as various other bits of information, HR policies, where to find them, that whole kind of thing. With that, that's the last slide. So I'm going to stop sharing screen. I think I'm handing back to you, Despina, to chair any Q&A.
Thank you both for the amazing presentations and all the tips and the information that you shared with us. Please share me the links and the copies of the presentation so that I can forward to people. Okay, thank you. And let's start the Q&A session. So, Tom, you mentioned that most researchers have the opportunity, and staff and students, I guess, have the opportunity to use the Career Center Development Center, and for staff, according to the Concordat, we are entitled to 10 days of career development. And you've amazingly put up a table where you showed us that we don't need to have a full 10-day course. It can be split into different bits and pieces, and each person's personal development can be individually planned, let's say. So how does the center, can you tell us how the center helps researchers plan this, their development? What can you offer them to help them identify which are the courses or the events or the stuff that they need to follow and invest to progress and to develop their career?
Thanks, Despina. And I think you're absolutely right. So 10 days at once feels like an awful lot of time, but then also not an awful lot of time. And I think the important thing is that you need to work with that time allowance quite strategically and in your favour. So, and Kate was talking about your case there, spending those 10 days in service of your case and in service of developing your case for you is really important. And I think that also, and so I'm not going to level a criticism, but we do know that people have difficult conversations about time for professional development with their line management. Part of making professional development easier for you and for your line manager to work with is saying why it's particularly beneficial, is having that strategy and having that plan. If you go onto our internal pages, you'll find the full listing of stuff that you'll find the full listing of our development offer to you there. And what each of those has got is a description of the kind of the pros, what we hope the benefits to you will be. So, for example, if it's mentoring, you can expect quite sort of targeted one-to-one time. You can expect to be learning from another person's particular experiences, and that might be a particularly good use of time for you because you want to get those experiences. It might be that you want to go onto a workshop because what you need is actually some ideas, some quick input, some sort of opportunity to hear about different concepts or different models, and then actually go and put them into practice outside. So it feels like a little bit of a cop-out to say, check the web pages. But I would genuinely have a look at our catalogue of courses on there, the descriptions of mentoring, of coaching, of time with the careers consultants, and then think about how each of those maps onto what you want to do. But fundamentally, the question does start with you. What do you want to do?
Excellent. Thank you, Tom. So the take-home message is think strategically about how you want to invest your those 10 days. And then, of course, you can talk to Tom and all the consultants that are there to help if you have any questions about what will be best for you. And coming to Kate, it's inspiring to hear that you see people's stories and not just people's career. So what do the consultants in your team offer those people to develop their stories?
I'm so glad that you heard that in what I said, Despina, that we see people's stories, not just their career, because that's so great. Thank you. You've put my job in a really nice light, so I will thank you for that. What do we offer to support people? I think partly it's almost actually what you said, that we look at them as a whole, and postdocs are staff. You are that bit older and more mature than, you know, the undergraduates and master's students that my colleagues talk to, and we recognise that, you know, whatever decisions you're going to take, that there's lots and lots of contingencies, there's lots of factors that you have to take into account when you're making a decision about what the next best thing for you is. So what do we offer you? Maybe a celebration of everything that you bring, because we celebrate all of those elements of your knowledge, attributes, skills and experience. We bring you to understand what those things are, and then I hope that we offer you inspiration, that there are good places where people are truly valued. The postdocs, what you can bring is truly valued by employers, and whether that's within academia, and that's completely fine, whether that's beyond academia, completely fine. I would love for somebody to be happy in the decision making, whether to stay, whether to go. So there we go, celebration, inspiration, and support. I guess those are the things that we offer our postdoc clients.
Excellent. So if people are unsure where they stand and they want to better understand or the skills that they already have and how they can use those and further develop those to improve their current status based on what their future target is career-wise, they can come talk to you and develop their stories.
Absolutely, yes, yeah, we will support them to develop their stories. That's completely it. Yeah.
It's been great to have both you and Tom today. Thank you for joining, and we have to stop to move to our next session, but we are delighted to have you here, and people can use the links that we will share with them to get in touch with you. Bye, everyone, and let's move to the next session. Bye.
Okay, we're live, and welcome to our next session, which is on data science careers after careers in research. I'm Emilia. I'm a postdoc in neuroimaging. I will be the chair of this session, and I'm going to introduce Dr. Ming, Tommy, Tang, and Dr. Ian Grant, who are going to speak to us about their careers, and then we'll take some questions. So we'll go through the most popular questions, so please ask any questions in the Q&A tab and upvote other questions, and we'll go through the most popular ones. And also remember to complete the online link for the feedback form to help us improve our session. So with that, we'll get started. I'm going to start with Tommy, if that's okay. Tommy is the Director of Computational Biology at Immunitas Therapeutics. Before joining Immunitas, Tommy received his PhD in Genetics and Genomics from the University of Florida and has been a researcher at MD Anderson, the Dana-Farber Cancer Institute, and Harvard University. His work has involved analysing large-scale epigenomic transcriptomic data, analysis automation using workflow languages such as SnakeMake, and leading teams to analyse immuno-oncology-related single-cell sequencing datasets, including the NIH-funded Cancer Immunologic Data Commons. He also has a keen interest in teaching computational skills to wet biologists and is a certified instructor for data carpentry. So, Tommy, can you please share your screen and we'll hear your slides.
Okay. Let me try it. Okay. Can you see my screen?
Not yet. There we go. Now we can.
Okay. So
yes.
I only have one slide. So yeah. So instead of like telling just you my career path, I'm going to tell you my story as well. So my name is, well, first of all, thank you for the invitation, and I really appreciate this organization. I wish I could have this type of event when I was doing my PhD and postdoc. Yeah. So my name is Tommy, Tang Ming in Chinese. So that's why I make it Tommy. And currently I'm the Director of Computational Biology at Immunitas. It's a very small biotech company. So we're trying to find new cancer drugs in the immuno-oncology space. Okay, so I will tell you a little bit about my story. Then maybe I hope I can share some of my experience. Then later you can ask some questions. So I did my undergrad in biotechnology at Shanghai Jiaotong University back in China. In 2008, then on actually August 8th, 2008, that was the opening day of the Peking Olympic Games. I remember really clearly. I was on the flight to the University of Florida to pursue my PhD in genetics and genomics. But I was actually working in a wet lab. I was trained in a molecular cancer biology lab. In the Department of Biochemistry and Molecular Biology. So at the fourth year of my PhD, that was around 2012, and my PhD advisor asked me to analyze the public chip sequencing data. And to be honest, like I didn't know any of the data analysis skills. I downloaded the data. It was about 2 gigabytes. I couldn't even open it with Excel. And that was the first time I realized I need to learn some data analysis skills. So I started to read books, watch videos, take courses. At that time, those online MOOC platforms just began, like edX, Coursera, and Udacity. So I took a lot of courses there and Googled a lot went to the question forums to ask questions. It was really tough at the beginning because I was just by myself and no one really does bioinformatics around me. So it was tough in the beginning, but later once you pick up the basics, it becomes much easier. So in 2014, after I finished my PhD, I went to MD Anderson Cancer Center to pursue a computational biology postdoc with my mentor, Rova Huck. He is a TCGA, the Cancer Genome Atlas glioblastoma guy, so he was leading that project. So that's how I had the chance to play around with really large-scale whole exome genome sequencing, RNA sequencing, and also bisulfite sequencing data. So of course, like chip sequencing or ATAC sequencing are always like dear and near to my heart. So I stayed almost 3 years there for my postdoc, and later as a research scientist. In 2018, I moved to Harvard FAS, Faculty of Arts and Science, Informatics Division as a senior bioinformatician. So at there, I started to collaborate with a neuroscience lab, and then that's how I started to learn how to analyze single-cell RNA sequencing data and the single-cell ATAC sequencing data. So after almost 2 years, and then I moved to Dana-Farber, so the Cancer Institute. So Dana-Farber actually is the comprehensive cancer center for Harvard, and so those two are kind of closely related. And there, I led a bioinformatics team of 7 people for a big NIH-funded consortium project called Cancer Immunological Data Commons. So in that project, there are 4 cancer centers in the States, like Dana-Farber, MD Anderson Cancer Center, Mount Sinai in New York, and then Stanford. They carry out immunotherapy clinical trials, and they profile patients using sequencing data, like whole exome, RNA sequencing, and TCR sequencing, and other type of image-based data. So our job was to pre-process those data uniformly and securely on the cloud, and then give them back for downstream correlative analysis. And last year, November, I made the big jump from academia to industry. So now I'm the director of computational biology at Immunitas. So it's been 4 months. So far, I really enjoyed it. So really, if you have questions between like academia versus industry, I can maybe give you some of the insights that I have. And by the way, so I have a blog post, my blog called DNA Confesses and Data Speak. So this is a URL here. So I usually write the things that I learned during my data analysis journey. So you're more than welcome to visit. And this is my Twitter handle. I usually share some of the tips for bioinformatics, and sometimes also complain about bioinformatics. Yeah, I think that's like my story. Then I think I will leave the questions to the audience if that's okay.
Sure. Well, what I might do is introduce our other panelist, Ian Grant, and then we can have some questions where
Sure.
I can bounce off of both of you. So yeah, Ian Grant. Dr. Ian Grant gained his PhD in theoretical chemistry from the University of Bristol and went on to postdocs in computational chemistry and computational biology and bioinformatics in Germany and London. In 2017, he switched sides from a user to a research platform engineer, providing support, administration and engineering of Rosalind, which is the shared hybrid cloud and high-performance computing platform at King's. Ian is especially interested in all things that intersect scientific research, data, compute and information technology. Ian, thanks for joining us.
Hi, thanks for the intro.
I can see your slides, so if you want to go ahead and make it full screen.
Great. Is that full screen? Can you see that?
Yep, that's it.
Great. Okay. Thank you for your talk too, Tommy. I think it's going to be interesting how closely our paths almost crossed, actually. So, yeah, I'm a research computing engineer at King's, and I'm first going to just brief overview of what it actually is that I do and what research computing is before an overview of my career. So research computing engineering covers a broad range of tasks. We do systems administration and engineering and architecture design of the platform Rosalind, soon to be create, as you mentioned, and that involves the hardware, software stack. So there's data center trips. There's also user support, and increasingly a large amount of data management. So especially in genomics, bioinformatics, the amount of data we're producing is getting so large that actually just shuffling it around is a task in itself. The kind of systems that I work with, obviously the high performance computing cluster that we run here at King's, cloud platform as well, Rosalind's OpenStack platform that we run here, and also public cloud platforms, so Azure and AWS that the research group that I'm part of makes use of, and we have some collaborations with NHS trusts and so on. So the kind of people that I work with is, what I like about research computing is it's not confined to the IT department, as it were. So I have technical colleagues in e-research and also KCL IT proper, academic colleagues in the research group that I am nominally part of, and collaborators across other research groups at King's, but also, as I said, NHS trusts that we collaborate with on digital innovations. And increasingly, it goes beyond just IT, so there's information governance is a big thing when we deal with sensitive data, whether that's human genomics or patient information, so on. And a large array of third-party vendors, so people who supply the hardware we use, software stacks, and so on. So I'll go through my career path as well. I did my degree and PhD, as you mentioned, in chemistry, computational chemistry, back at the end of the 90s in Bristol, when the kind of computers that we used during my degree looked like this, Silicon Graphics workstations, if anyone remembers those. And then by the time I was doing my PhD, a high-performance computing cluster looked like this. So it was a bunch of computers on a shelf strung together. If you were lucky, it was in the basement. If you weren't, it was in the office next door to the postdoc lab or something like that. Here's the group I was part of. So Adrian Mulholland was the professor there at Bristol. After that, I moved to Germany. So still staying in theoretical chemistry. University of Bochum. So that was a very similar domain to my PhD. It was quantum chemistry calculations, molecular dynamics simulation. What was great about that experience for me was the step up in terms of the computational stuff we did. So by then, I got to make use of supercomputers like this Blue Gene computer that is in Jülich in Germany. So that's a European-wide platform that you could use, and it's really massive, hundreds of thousands of cores. So that was daunting to use in some ways, but also exciting. I mean, you can do stuff on those systems that you can't do anywhere else, basically. After that postdoc, I moved to London and a change of field. So this was the common theme for me was that it was still computational, but I moved into bioinformatics and genomics. So a little bit like Tommy was saying, I didn't have any experience of bioinformatics workflows. I definitely didn't have any experience of biology. So that was it was in a mixed lab. So there were some computationalists and some wet lab people, and that was great for being able to see the science done. Someone on the bench opposite you is producing the actual tissue that's going to be sequenced, and you'll handle data later. But it was also, I was reading undergraduate level biology books and trying to catch up fast, and I quickly realized you can't learn it all. You have to pick what you need to know, but you do pick it up quickly. And what I'd started to move into there, so that spell was across 2 institutes, the MRC in Mill Hill. So this is the view from the cafeteria at the MRC, Mill Hill in North London. That was a great place to work. And that became the Francis Crick Institute in central London in 2016-15. I started to move more into sysadmin and engineering then. So we had some small compute capacity in our group, and that was managed by us rather than NIMR's IT department and so on. And I picked up more tasks of keeping that running and some of the websites we ran as well at the same time. So when it came to joining King's and what I consider leaving academia, although I'm still in an academic environment, I moved to this IT role and basically leverage the sysadmin and engineering skills that I'd been starting to pick up. So it was a transition to, like I say, an IT role. I don't have a research profile anymore, but it's nice that it was still in an academic environment, still in touch with lots of scientific research, and the common theme for me was that, or I feel, was that my scientific background helped me move into this position. So, the people who we work with day to day are doing the kind of bioinformatics workloads or simulations that I used to do. But it's not to say that I didn't still have a lot to learn. So, I work more closely with a corporate IT department, as it were, day to day. And then finally, I've got a little slide on, things you pick up with hindsight. So I think, putting these slides together makes my career look a lot more seamless than it really felt, than it has felt over the last 10 years or so. But I think with hindsight, transitioning domains or roles within the same environment is easier than you think. And for me, that was the stepping stone to moving to where I am now. I didn't feel like I could do that in one step, and I didn't feel like I was competitive in a corporate market, for instance. So it was a natural progression to take those tiny steps to me. And I realized that your specific skills don't have to be directly applicable. So making that transition, but within academia still, you don't have to go back to square one. I didn't have to go back to square one to be a biologist. I'm not saying I was a very good biologist, and you don't have to go back to square one to be an IT professional, but you have to, pull in the skills that you have from different environments you've worked through. And finally, I suppose one thing that I wish I'd known, or find it useful that I know now, is that job descriptions are probably not as helpful as they ought to be. So I think about my job now, day to day, compared to what the role said when I applied for that advert. It is almost, there's almost nothing that's the same. So I now don't pay so much attention to those things, I guess. I think now we'll take some questions, but I'll also just briefly say I'm at the SGDP Centre. I forgot how sunny it is at 11 a.m. on weekday mornings, actually. And I'm happy to chat to anyone who who wants to talk about these kind of things. I'll just end my slides.
Great, thank you very much. So we have a couple of questions that came up in the chat. It's quite good because they've actually, some of them can tie in with some of the ones that I had listening to your talks. So I think for both of you, one of the key things is that, yes, you've transitioned out of academia, and Ian, you touched on it really nicely just at the end with your hindsight, but how useful do you think your skills are that you have that you've developed during your PhD? Do the skills translate easily? Is data basically, and how important is field-related experience? So Ian, you've just spoken about that, but maybe Tommy, if you have any thoughts about that.
Yeah, go ahead. Or do after you.
Oh, sure. Yeah. I mean, I think I covered it in my slides. Yeah. if you're interested in making a transition, but clearly staying within some fields, you probably, the kind of people who we're talking to today, I imagine, probably already have the skills you need in terms of working with data and so on, and the nascent skills you need to pick up new skills, as it were. Looking at your own skill set is a useful task, and what I took from that was that I think I wouldn't pay too much attention to things like trying to pick up Python for the sake of picking up Python. You probably already have skills for working with data. Yeah, I think that's it.
Sure. And Tommy?
Yeah. So actually, I made two big transitions for me, like from wet lab to like computational biologist. This is the first big transition, and then second is from academia to industry. So for the first transition, I want to echo again that the scientific background helped his job in IT, right? Like actually, my wet lab experience also helped a lot for my career as a computational biologist. And actually, because I have the wet lab experience, I understand what the wet biologists are doing, and I can communicate much better than those pure, computer science people. So all the experience are good experience. I will say you always learn something from there. And as far as the second transition from academia to industry, I find the skills so as a PhD and postdoc, we do presentations, and those are communication skills. This also very important in industry as well. And the same, similarly, like project management, and if you mentor people, the same thing. If you go to industry, if you want to lead a small group, you will need to learn some of the people management skills, and yeah, I think those are all transferable skills. And in terms of technical skills, like data analysis, I would say my experience would be I'm doing almost the same thing as I was doing in academia. So that's actually definitely transferable. But of course, yeah, go ahead.
Oh, that was actually going to lead really nicely into my next question. So there's a question about the main differences between academia and industry. And I wonder, in your experience, not just what are the main differences, but are they as different as you thought they would be? So like looking into your research careers when you were about to make the transition out of academia, you may have had some expectation about how different the change might have been. Did it live up to that expectation? Was it more different? Was it more similar?
Okay, that's a good question. Yeah, so I was actually afraid of being like not able to do what I want to do in terms of doing research, because people enjoy the freedom of doing research in academia. But then later you think about it, even in academia, you're not doing things that you want to do. You're doing things that can get funding. The same. So in industry, actually, like funding is not actually a problem, because you have all those investments from the venture capitals. You have a lot of actually cash actually to do what you want to do. So actually, quite to the contrary, you can do a lot more things more efficiently actually in industry. But of course, there's a difference between industry and academia is that in industry, everything moves very fast. So like the goals can change like from month to month, and the project can be killed like maybe after 6 months. So but for your PhD or postdoc, probably you will work on the same project for 5 years. And I think that's the major differences as far as I can tell. But in industry, I can tell people are still doing really excellent research and trying to translate directly to help patients. I think that's something I like. Yeah.
Yeah. Excellent. Thank you. Ian, anything to add to that?
Yeah, so I can echo similar sentiments. Yeah, I mean, obviously I'm still in an academic environment, but my role is no longer research focused. So some of the similar things about projects moving much faster also apply to what I do. And also having many more projects to deal with. So, I don't have one thing like I did in my PhD, and you have to manage that kind of workflow yourself. I think the other thing for me on a personal level is, and I worried about this when I left research as well, was in academic research, you often, you validate your career by papers or funding, whatever. And I felt like, am I going to be lost without that? But especially being in the same environment still, but no longer producing papers. How do I measure my career? How do I validate my work? And people probably find that in different ways. But for me, in the IT professional industry, that has come through sort of certification. So there are lots of courses that you can do on things like how to use a technology, a cloud provider or whatever, and you can do. I enjoy learning, so those have intrinsic value in themselves, but also certifications that you can do as well is something. I mean, that is my boss is also supportive of that. He realizes that we need to build that kind of career progress in. So having someone who supports you in how you view your career, I think, is important to think about.
That's great. So we have a couple more minutes left, and there's quite a few popular questions popping up in the chat, and I want to get through as many of them as possible. So I'm going to do this one first and then maybe try for one more. So the question is, do you think it is too late to transfer from wet lab-based research into data science after doing a postdoc for 4 years? I.e., would data science companies be more inclined to employ someone just after their PhD compared to a postdoc? I think it's difficult to give a correct answer to this because wet lab-based research, what degree, like no computation versus, Tommy, who has been doing single-cell transcriptomics. But yes, Ian, do you want to go with that one?
Yeah, I mean, I felt like I switched domains. It wasn't wet to dry sort of thing, quite late, but with hindsight, it's not a problem. Being in a mixed wet-dry lab when I was doing computational biology, that was the beginning of a focus on people having both of those skills. So, 15, 20 years ago, having just wet skills would have been enough for your career. But now, I think increasingly everyone in that field needs both. And so, if you have that background already, whether you're going wet to dry or dry to wet, it's always useful.
Great. And Tommy, anything to add to that?
Yeah, I would say like your motivation is really important. Do you really want to learn, and why do you want to do the switch? It's purely based if you really like it. I'm saying, like, I remember the day like when I started back in 2012. So after all the wet lab experiments in the day, of course that time was single, I could sit down and just play with all this code like until like 10 o'clock, 11 o'clock, and also took those courses, right? So if you're really interested, you're really motivated, you can always do it. And the best time to switch, right, is maybe 6 years ago, right? But the second best time to switch is current.
That's very good. I like that. So basically the short answer is no, it's never too late. And the last question I'm going to push for, because we have about a minute left. Did you have mentors that were crucial to your path? I think this is, a really great question. Either of you?
No, I didn't. And I mean, I've had supportive people in my careers, but no one I'd really call a mentor. And I think that's I also never had these kind of events. So I went to a bunch of events like this, but there were always speakers were Nobel Prize winners or people at the head of their scientific career, and I didn't feel like there was this focus on things outside academia. So I didn't, but I wish I had.
Sure. And Tommy, any mentors for you?
Yes, I do have some mentors, but they are like at my later stage during my transition. But at the very beginning of my transition, was all by myself. So I understood how hard is that. And that's why, like, I'm as you see, like I'm also an instructor of data carpentry. Like you can Google that, data carpentry. So it's a nonprofit organization who teaches like researchers who have no programming skills, like how to program in R, Python, and Unix. So now I'm chaired the genomic curriculum division. So I'm trying to help other people who, like me, who have no experience, just make the transition a bit easier. So I believe they also have many people like instructors in London. So maybe you can have them to come and give you workshops. Yeah.
Excellent. Well, that's our time. Thank you both for your very informative career talks and also the questions. I'm sure that there was links going around in the chat for if you want to contact these guys anymore. And yeah, a big thank you to our presenters. Thanks for watching.
Hey, so hello everyone and welcome to session 3. Session 3 is about entrepreneurship, and I'm delighted to present Dr. Emilia Molimpakis and Dr. Sotiris Kakanos that are two speakers. And whenever you tell a researcher that about entrepreneurship, they get scared about the whole idea of entrepreneurship, but in reality, academia and entrepreneurship might be more complementary than most researchers think. So we have here Dr. Emilia Molimpakis, a neuroscientist and co-founder and CEO of Thymia, an AI platform inspired by video games to diagnose depression, and Dr. Sotiris Kakanos, who is a postdoctoral research associate and founder of the Autoscientific startup, a startup that creates and sells devices that automate lab processes. And in their talks, they'll talk to us about how they made the transition from an academic research environment to entrepreneurship. Emilia, are you ready to start?
Sure. Yeah, absolutely. Perfect. Hi, sorry, can you hear me?
Yes. Yes.
Okay, perfect. So I don't have any slides or anything to present, but I thought I would just give you guys a rundown of my background, my history, and how I ended up into entrepreneurship, and hopefully show people or inspire people to make that jump and to show that actually it's not as hard as people think. And if I can do it, then anybody else basically could do it. So I started out my career very much focused on being an academic. I started out in Greece and started off with linguistics and Greek philology, did like my undergrad there. And during that undergrad, I was exposed to kind of neurolinguistics and neuroscience. And I started moving more into that area and looking at different population groups and seeing how these different populations are basically using language. So that kind of prompted me to go into neuroscience. I then came to the UK and I did a master's degree and then a PhD and several postdocs at UCL, kind of focusing more on experimental psychology, cognitive neuroscience, and also the element of linguistics. So for about 12 years, I was a researcher. And I started out looking at healthy individuals and then going into neurodegenerative disorders, predominantly Alzheimer's, vascular dementia, aphasia, post-stroke, and then moving into mood disorders like schizophrenia and depression. But for all of them, I would use language as a biomarker for their cognitive decline or their cognitive progress as a response to treatment. And by language, I mean both the actual vocal elements of how somebody is speaking, but also the content of what they are saying. So both the sound and also the words and the structures. As I said, so I was kind of very much fully focused on being an academic. I had kind of like an academic career set in front of me. I was publishing papers. I was looking for ways to stay in academia. And that all changed when my best friend at the time, who was also an academic, developed depression. As I'm sure most of you are aware, this is quite common. It's not unfamiliar for academics to develop mental health issues, particularly depression. And so it wasn't odd that she did this. What was concerning was that she tried to go through the NHS healthcare system and, like so many others, fell through the cracks in the system. So within just 3 months of showing signs, she deteriorated really quickly. And even though she was seen by a psychiatrist, she ended up trying to take her own life. And when that happened, I was the one who found her. And thankfully, she wasn't successful. However, it's not a great tale. She was hospitalized, and now she's been institutionalized again. So not a great tale, but also really unfortunately a very common one. And so when this happened, as a best friend, I felt a sense of responsibility, of course. Like, how could I not have seen this coming? But what I couldn't get my head around was how her psychiatrist, who she'd only seen 2 days before, how they didn't see this coming. And so that prompted me to look into the psychiatric system here in the UK in more depth, which wasn't something that I'd ever done. And I realized, hey, actually, even though we were, like all of this research we've been looking at for the past 20 years has been advancing so phenomenally, clinicians are still using the same subjective questionnaires that have been used since World War I. It's insanity. Like, it's 100 years. These questions have not changed, really. And it's something as simple as, on a scale of 1 to 5 in the past 2 weeks, how suicidal have you felt? Like, if that's not a leading question, I don't know what is. And so I realized what was lacking in mental health as opposed to physical health was ways to objectively measure and monitor whether somebody does have depression and how they're responding to treatment. And that's when I realized actually what I'd been learning, what I'd been doing could be applied. It's just that clinicians don't have those tools. So if people like me don't leave academia, then those tools are never going to be, offered to them. And so I quit my postdoc. I had the potential to stay kind of indefinitely at UCL, and I turned that down. And I joined an accelerator program here in the UK called Entrepreneur First, which is actually probably one of the best ways for academics to get into entrepreneurship if they're like me with no business background, because it focuses as an accelerator on bringing people together from different backgrounds who may not have had any business kind of experience, and really bringing them together in a way that allows them to build a company around a really strong idea. And it also teaches them how to fundraise, how to do different things. And so that's what I did. I met my co-founder there, Dr. Stefano Goria. Very different background to my own, but an amazing complementary skill set. And he essentially brought all the machine learning and the AI elements and the technical components to Thymia. And together we essentially built the company. That was 2 years ago. Since then, we've raised over £2 million in funding. We've built out the product. We're going live with 100,000 users in the next 6 months. We've got clinics across Europe and the UK using Thymia. And yeah, it's been really, really amazing, exciting trajectory, and definitely not one I planned at all. But I think it's proof that you can definitely do this, even without business. And I'm the CEO. I'm not the CSO even. So yeah, it's been great.
Thank you so much for the amazing, for telling us about your amazing journey. Let's move to Sotiris, and then we'll come back with the Q&A session.
Can you hear me okay?
Yes.
Excellent. That was a really nice story. Thank you, Emilia. Let me just try and share my presentation. Hopefully you can see that now. So can you see that?
Yes, yes.
Excellent. Okay. So hi everyone. Thank you for taking the time to listen to my talk and for coming today, and to the organisers who put this together, and for inviting me to contribute. So my name is Sotiris, and I'm the founder and CEO of a brand new company, very new, called Autoscientific. And as someone who likes science, who likes doing research, I'm basically trying to answer the question, can I keep being a postdoc while not relying on traditional funding streams? Can I find myself and give myself the freedom to research what I want to research? So my research journey started in 2016 with the beginning of my PhD here at King's College London. And my aims were to research drugs that might one day reverse the paralysis that's brought on by ischemic stroke. So stroke is a leading cause of disability worldwide. 120,000 people will have a stroke this year in the UK alone, and 3/4 of those who survive will leave the hospital with motor impairments. And there are no drug treatments options available to them to reverse their paralysis and to restore some quality to their lives. So as part of my PhD, to test whether drug therapies could reverse paralysis, I'd very often have to do something called the single pellet reaching task with mice and rats. So this is an animal model of skilled human reaching, which after stroke is impaired. And it is used in many labs worldwide to research motor learning and dysfunction. So to do this task, a mouse or a rat are placed in the reaching chamber. You can see that hopefully in the video. And they're encouraged and trained to reach for a sugar pellet reward beyond a small vertical slit within the chamber wall. And at first, the animal often misses, but with time and training, the animal learns to retrieve the pellet, the majority of attempts they make. So we then use this assay to assess motor recovery after brain injury when the animal is given a novel drug candidate. So if the therapy is a good one, their ability to reach for the pellets is restored. So the issue with this task is that it's incredibly long-winded, cumbersome, and prone to human error. It requires that the technician sits there manually scoring whether the pellet was taken or not, and manually replenishing the pellets. So these experiments often last for months, and it left me imagining ways this could be done better. I literally had to spend every single day in a room filled with rats, giving them sugar pellets. So I wanted to automate this task, but as a neuroscientist, I didn't have that engineering background. So I taught myself to code and to model using CAD software, and after many iterations, this is the solution I came up with. And that has worked most reliably, and it formed part of my PhD in neuroscience. So I've called it the Reaching Bot, and it's the first product I'm commercializing with Autoscientific. It has this reaching chamber on the left and an automatic pellet dispenser on the right. It also has a camera, which using computer vision and artificial intelligence classifies the outcome of each trial automatically. And also there's a cross-platform application that lets users decide how long they want to run the devices for, how many trials they'd like their mice to do, and an interface that lets them inspect the data they generate. So here's a video of 10 devices training 10 mice in parallel in a completely automated way, liberating the scientist to take care of other scientific matters. So it used to take me about 10 hours per day to train 30 mice. It now only takes 1 hour, and it's unattended, so you can just chill and let them carry on. So having founded the company in October last year, I'm still very new to this game, and I don't know what I don't know yet. But I'm seemingly having some success. I applied to the SolidWorks Entrepreneur program and was accepted. So now have access to really powerful CAD software for free, and lots of industry-leading manufacturing professionals are on hand to help me. And I now have clients at EPFL in Switzerland and Ohio State University. So I have some funding coming from sales income, and I have some academic partners at King's College and at the University of Edinburgh. So things seem to be progressing. Whether I can continue funding my research endeavours, well, ask me again in a year and we'll see, but it's positive so far. So if you want to, thank you for listening, and if you want to continue this conversation, feel free to message me on Twitter or LinkedIn, or just email me on the email shown there. Thank you.
Thank you, Sotiris. Great presentation, and it's nice to now start the Q&A session. So it was wonderful to hear you both your stories. And one of the questions that comes up is, okay, Sotiris wanted to solve a practical issue, wanted to make his life easier. Emilia wanted to solve an issue that was really close to her heart. So you both had a strong drive to build your companies. And as I can see, you've invested a lot of personal time, but in practical terms, because I guess many people from our audience also have this high drive to build something new. In practical terms, who helped you along the way? Because we are researchers, we don't have the background, as Sotiris mentioned, to do certain things. What is that helped you? And Emilia, you mentioned Accelerator first, and it will be great if you could share a link to that. That's maybe something that can help other people that are listening to us right now. But can you tell us some things that helped you along the way to make the transition?
Emilia, you want to go first?
Yeah, sure. I'm happy to do so. So I think for me, definitely Entrepreneur First, the Accelerator, was the catalyst to do so. And to kind of explain also, when I joined EF, I wasn't expecting to be the CEO of the company. I was expecting to be the CSO, so the Chief Science Officer. Ended up becoming the CEO because that's how Entrepreneur First works. They do two-person teams, and the goal of the team is to be able to build essentially what you need to build. And so I needed an AI and technical person because I couldn't build myself. Similar to Sotiris, I didn't have the engineering skill, but I also couldn't teach myself. The Accelerator helped by explaining how fundraising works and by exposing us to funding companies, like to venture capital funds. I would say actually what helped me was just getting out there and pitching to investors. It was an incredibly painful journey, I have to say, for I kind of just through, trial by fire for the first 6 months I was pitching, and I kept hearing no. I think I've met about 500 VCs at this point. I've pitched my company 1,200 times, maybe 1,500 times. And really it's just kind of evolved over time. I would say it can be a lot easier. You should definitely be talking to business consultants, business advisors, not these people who contact you on LinkedIn who are trying to just get money out of you, but try and apply for Innovate UK funding. I got a Young Innovators Award, and that was business support for a full year for free, which was super helpful. And I also engaged with a lot of advisors, like other people from the cohort who I hired essentially as consultants. All that was super helpful. But for the past 2 years, I've been the only commercial person in the team. Now we're bringing in, we just hired a Chief Growth Officer and VP of Operations and Finance, and they're really helping to accelerate. But I think looking back, I would have probably brought more commercial people on board sooner, simply because we're a deep tech company. We can't generate revenue straight away, unlike potentially Sotiris. So we need VC funding. And so the sooner you can speak their language and the sooner you understand that landscape, the better. I don't know if that was helpful or...
Definitely, because you told us that it's a lot of trial and error and you get many rejections, similar to academia, I guess, in the beginning. So you need to have a very strong stomach.
Yeah. Yeah, and also something to be aware of for academics is the bias against women and against minorities. It's something people talk about generally, and in academia we think we see it. It's nothing compared to pitching to investors. They are so strongly biased against women. It's incredibly hard to pitch to them as a woman. So that's something to be aware of. You'll get horrible questions. You'll get pushback in so many ways, and that's something to just be prepared for and to push against. just so that you're aware. I wasn't aware. I wish I had been.
It's good to hear this. And now I'll move to Sotiris so that he can also talk to us about the challenges that he encountered when he first started, how he tried to overcome those challenges. And as people are asking, your company is probably a spin-out company. So was the university supportive in the beginning?
I haven't really spoken to King's, and I should actually start speaking to them and getting in touch with their entrepreneurial sort of avenues. But we spoke to them very early on about intellectual property and patenting, and they were helpful with that. But for my technology, the technology wasn't patentable. So I'm basically going at it alone and trying to overcome that challenge basically myself. But this is all very new to me. So the things that Emilia is saying is really helpful. So I don't yet know what I don't know basically. So I will be looking at accelerator programs to see whether that helps. But in terms of the support that I had earlier on, my supervisors were amazing. So Dr. Lawrence Moon was my first supervisor, and he had a startup too. So I kind of learned from the challenges that they had, what to avoid and what to do. And my second supervisor was an electrical engineer, and he kind of guided me with the whole engineering journey that I undertook. But I found that actually the internet is an amazing place to learn things for free. The coding, the programming, the programming language that I use is Python, and I think most people know now that you can learn yourself using internet resources. So the world is our oyster. The internet does give us a lot of opportunities to learn, basically. Yeah.
Okay, it's good that you could rely on your supervisors, because that's not always the case. It's good that not only they could give you insights based on their backgrounds, they also offered you support to do that in parallel with your studies. And that links well with one of the questions that we have. So when did you feel that you could really take the leap and leave the position and start funding yourself, supporting yourself? Because it's a big decision. And so I'm not certain if that was the case for you, but as Emilia said, that was definitely the case for her. So do you want to quickly answer and then we can move? Sorry.
It's scary, and I am anxious, and I don't know whether it will work for me, but I thought to myself, now when is a good time, So I'm just giving it a go, seeing if it happens, and if it doesn't happen, then I'm taking a risk basically, and I'm in a very privileged position. I can take that risk, but we'll see what happens.
Emilia, what was the case for you?
I think for me it was, as an academic, I guess you're never fully secure. There isn't necessarily going to be a position for you where you are after the next year or 2 years unless you're in a tenure track position. And I think that's kind of mostly the case with academics. So for an academic to make the jump to entrepreneurship, for me at least, it doesn't feel like you're giving up security and stability in that sense, because there is none at that level unless you're a professor. It's very different compared to, say, somebody who's dropping out of finance, which was, for instance, the case with my co-founder. It was much, much more risky for him to give up a position that paid him literally £300,000 a year, essentially, for something that paid nothing. What helped me was the accelerator program itself. Different accelerators work differently. The one I was on actually gave us a basic salary to begin with to allow us to fund us for the first 3 months, to allow us to essentially live basically while we were doing the program. And then they gave us a small kind of 80K investment to begin with, and that was to cover both of the founders as well as everything we needed until we raised money. We got really close to not making it because we were pushing and pushing and pushing, but we didn't know how to pitch well. We didn't know how to create the narrative in the best way. We finally got it, but it was very kind of difficult. And I think you need to be willing to, A, be willing to stomach that risk, and B, know where your boundary is. There's no right or wrong answer. You may say to yourself, I'm okay with burning my cash reserves up until this point. You may not be. There is no right answer, but be aware of where your limits are and where the limits of your co-founder are, and respect those as you go. And definitely, Sotiris, I don't know how you've made it. If it's just you, I would say having a co-founder is really helpful. So kudos to you for managing by yourself. I don't think I would do it without Stefano. So
we'll see. We'll see how long it lasts.
Yeah.
Well, it's definitely, difficult to do it on your own, and also, as you said, challenging to do it even with help. And thank you so much for sharing this experience. It's important for our audience to hear that. But this also brings us to our next question, and I want your opinion on that. You're creating new knowledge, new technology, and wouldn't be good for the university to actively support that and the institution benefit from it? So what do you think about that? That would make it maybe your life easier, but also allow the institution to benefit from these technologies?
So Thierry, I don't know if you want to take this as a spin out from King's, otherwise I have quite a strong opinion on this.
I don't know. I can only speak for King's, really. I'd say that the IP department were helpful, but I think they're more interested in drug treatments more than they are robotic solutions. It could just be my lack of researching, and basically what I like to do is product development. I like to mess around and make robots and see if they work or not. So I haven't really explored the commercial options available to me by King's. But yeah, if that, it would obviously be really useful if there was a strong entrepreneurial program that King's offered, which isn't known to me thus far.
Yeah, happy to provide my input here as well. So I had quite, obviously coming from academia, I had quite a strong academic network. And so Thymia, one of the big things of Thymia is that we collaborate with various universities. So we have very strong partnerships with UCL, King's, Oxford, the Alan Turing Institute, Edinburgh, etc. However, and there with each of these universities, we have encountered basically their business division within the kind of, it sits, let's say, on top of all of the different scientific areas, and it kind of handles how the university interacts with the industry. And our experience thus far has been actually really problematic with all the universities in terms of IP. Most universities, particularly Oxford, Cambridge, UCL to a certain degree, King's, they have very strong IP ownership, kind of benchmarks or something. They come in really, really aggressively wanting to own a lot of what is being done. And that doesn't align well with the startups kind of moving forward. You want to own the IP, especially if you've created it after you've left the university. And universities have very strong kind of targets that they need to hit there. And so it doesn't always align. I would say what Despina basically said, that there should be an alignment of incentives because the university should be able to actually benefit from this. In actual fact, what happens is there is this struggle over IP and over royalties and different things, which makes it really hard, and it kind of pushes startups away from working with them. So we've been in conversations with UCL for a year now, and we still haven't got everything lined up because there's a legal kind of question backwards and forwards, and it's slowing us down. So, and I've had that experience being kind of told to me again from other startups. I would say if you can do it outside of the university without involving the university in terms of IP, then it's way better because you'll you'll move faster and you'll get more as a company. But yeah, unfortunately, universities seem to be kind of like stuck in the past. One thing I have seen in terms of collaborations with universities, which does work quite well, is instead not IP, but funding PhD studentships and postdocs. So we're setting up one with King's now, where we're funding a couple of PhDs through Thymia. That works a lot better, rather than kind of direct partnerships.
I see. So it's been great talking to both of you. We are coming to the end of the session because we need to invite our next speakers. Thank you so much. And hopefully the universities will be hearing us and try to improve their processes so that we can have more direct and indirect collaborations in the future with entrepreneurs and industry. So thank you all, and we are ready to move to our next session, and that will be session 4. And in this session, we will be introducing science communication. We have our next 2 speakers. I'm not certain if we can see the speakers. Sorry, give me.
Hello?
Oh, hello.
Hi, can you see and hear me?
Yes. We can see and hear both of you. So it's Dr. Nicola Williams, Science Communication Officer at Alzheimer's Research UK, and Dr. Karli Montague-Cardoso, Editor in Nature and Neuroscience. We are delighted to have both of you here today. Both speakers will briefly introduce themselves and their career paths, and then afterwards they will join our Q&A session. So please send your questions. I know that you are all very interested in listening to their career paths and getting your questions over so that you can learn from what helped them make it to where they are today. Who wants to start first?
I don't mind going if you don't mind.
Sure.
Okay, so hi everyone. Thank you so much to the organisers for having me here today and for allowing me to speak about my career path. I guess first thing I should mention is that I'm not actually a doctor. So I actually didn't do a PhD. I have had a bit of research experience, but I now work in science communication. It's a role that I really enjoy, and before I talk about that though, I probably will just give an overview of how I got here, from going from biochemistry to being a Masters by Research dropout to being a year having industry experience, and then how I got into psychoms. Okay, so let's go. Okay, so I work at Alzheimer's Research UK. We are the leading dementia research charity in the UK, and basically what we do is we support research into understanding the diseases that cause dementia. And I guess like part of my major role in psychoms is communicating to people why we need dementia research. So I guess first off is to say that there's a sort of gap in awareness between researchers and in dementia and kind of the general public. So there's still a bit of a misconception of people thinking, oh well, dementia is just this disease you get when you are getting old age, like, you know, it's just inevitable. Well, actually that's not true. So dementia can be caused by several different physical diseases in the brain, of which Alzheimer's disease is the most common. So part of our role is to try and dispel that myth that it's an inevitable part of aging. There's also no treatment or cure that reverses these diseases once they take place. So unfortunately, once you have it, it is progressive. And right now, the most recent stats estimate that approximately 1 million people in the UK are now living with dementia, and predictions have been made that kind of indicate that 1 in 3 people born now will actually go on to develop dementia at some point in their life. Where Alzheimer's Research UK come in is that we hope that research can change this. And so the types of projects we fund might be exploring, for example, what processes affect amyloid and tau, so toxic protein tangles that form in the brain. What affects these processes? Can we screen for chemicals that could act as potential drug targets? But also it can be anything from this to how the gut microbiome influences inflammation and then can affect the disease process, and also looking into ways to reduce our risks, so looking at the role of heart health in protecting our brain health as well. So I guess that our primary aim from all this is what we'd like to vision is a world without the fear, harm and heartbreak of dementia, and find a life-changing treatment for the various diseases that cause it. So I guess in terms of me coming here, one thing I should mention is that I'm not from a neuroscience background. So I was actually a microbiologist before coming here, hence my bias towards the gut microbiome research and that sort of thing. But actually I did my bachelor's degree in biochemistry at the University of York, and I graduated in 2016. So I uni was a challenging and difficult place, and it was chaotic, but I really actually enjoyed my 3rd year. So whilst all my friends were freaking out about their research projects, I absolutely loved it, and I did really well in my research project compared to other aspects of my degree. So I thought, oh, well, maybe there's hope. Maybe I can go on and do a PhD and things like that, because I really enjoy getting into the nitty-gritty of why things happen. So I did a master's by research, kind of looking at in more chemistry side of things. However, that turned into a bit of a disaster, and I actually ended up dropping out halfway through. So I'm officially a dropout. And, but actually, that was one of the best moves I made, actually, because I learnt a lot from it. It's just that the pressure, I think, to get my research kind of published, and the academic pressure, my peers had their names on 2 papers already, and I was just thinking, my experiments won't work. And I think the pressure was quite daunting, and so I actually thought, well, industry's something I haven't tried yet, so let's do that. And luckily I got a job in biotech, and looking to make solvents from these bacteria called Clostridium, not botulinum type, not the nasty type, the okay type. And so that was interesting as well, because 2 years in we had a restructuring. So I went from being in the lab actually culturing the bacteria into, we flipped our kind of business plan on its head, and basically I had a role change as well, moving into commercial research. And so that was kind of, I went into desk-based research. But I actually really enjoyed that, because my strengths are going into literature research, doing a bit of patent searching, so intellectual property, and this helped establish our product portfolio. Then of course COVID hit, and that's when I actually discovered, I've always liked drawing. So during my furlough time, I started doing science illustrations. I love manga art, so that's what I based it on. And it was from this, when I came out of furlough, that we were in a position to start doing more marketing. And so I used my illustration skills to learn Adobe. And then, so some of the BioCleave adverts on LinkedIn, Twitter, and our website, so some of the graphics for that, I helped produce those. So I guess that's kind of brings me to why I wanted to move from there to Psychom. So I was with Biocleve for 4 years, but then I thought, actually, I want to do more talking about research, because being in biotech, you can't exactly tell everybody what you're doing because of all the confidentiality and things like that. So, and what I really liked about my role was saying why this research is important, like why is this protein needed to, say, combat diseases like Alzheimer's, for example. And one thing that's been consistent throughout my scientific career experience is that I actually find the way research is presented like to be quite inaccessible. It's difficult to digest. Like for research papers, even now, even though it's part of my day job, I still need a dictionary to like get through the paper. Like what does concomitantly even mean? I mean, yeah, it's just such a bugbear of mine. And what with COVID as well, it became apparent that it's not anybody's fault, it's just the way it is that there's a massive gap between what researchers know and public knowledge, which is why, partly why I guess in the case of dementia research, there's, according to a recent survey we did, it's about 1 in 3 people still think that dementia is an inevitable part of aging, and they don't realise that actually research could try and tackle the diseases that are going on in the brain. And so that's kind of how I ended up here at Alzheimer's Research UK, and I have no qualifications in science communication. I'm going purely on experience. But I've been here 6 months now. I really enjoy it, and I get to talk about the research we do. Woohoo! And this can be anything from like website posts to blog articles. I've actually done 2 now, which are on the website. And I've also helped create animations for our social media as well. Kind of taking stuff that I learnt at Biocleve, but I just get to do it on a larger scale, and I get to talk about our research more. And I just hope that by doing this is that my aim is to kind of help science to be less scary for people who don't have a science background, because people have said to me in the past, like, oh, blind me with science, like impress us. And I'm like, well, if it's explained properly, then, you know, get a nice infographic in there and have like effective science communication, then hopefully science can be a lot less daunting. Thank you. That's my talk.
Thank you, Nicola. That was amazing.
Thank you.
And, we dementia researchers definitely depend on you to make our work, to help us communicate our work better to the public. So many thanks.
No worries.
You share your career path, and then we can join the Q&A session.
Okay, so I'm just going to share my screen. Don't know if you can you see my slideshow okay? Oh, you've gone quiet.
Yes, now we can.
Yep, okay, cool. So yeah, I'm Karli. I'm an editor at Nature Neuroscience, and I'm just going to speak to you today just about, you know, my path to becoming an editor, just to touch on that a little bit, and then really focus more on speaking about what it is that full-time editors do and how you have to adapt if you're coming from academia. And the reason for doing that and spending more time on that is because as an academic, I was actually not fully aware of what it is that editors do. So I think it's important to realise what it is that they do actually do. So editors at different portfolios will have different qualifications. So at the Nature portfolio, for example, all editors are expected to have a PhD, and obviously this is because it means that they're, you know, able to critically evaluate papers and understand the techniques that are used behind the experiments, and that they have strong communication skills, but also that they understand the publishing landscape and also the, you know, the hurdles that researchers face. Different portfolios will not always require editors to have a PhD, and that is because the role of an editor does vary from publisher to publisher. So I can only really speak about what editors at the Nature portfolio do. So my path to becoming an editor was actually quite a long one. So I did my undergraduate degree and my PhD both at UCL. And then I moved to King's College for my first postdoc. So initially I was working at the CDN, looking at the development of cranial nerves. And then I moved for a second postdoc at the Wolfson, and I was looking at the underlying mechanisms of chronic pain with an emphasis on neuroimmune interactions. And I actually, I spent almost 10 years as a postdoc. And for me, the decision to leave academia, there was two very clear reasons for me to leave. One is that I had very severe mental health problems during the entirety of my academic career. And in my personal experience, and it's probably, a very common one, the support in place from line managers from the institutions I was at was severely lacking. And so it really wasn't feasible for me to continue in a career where there was no stability. And second of all, I became a mother. And again, it was really a struggle to try and juggle putting in the hours needed to secure funding, to work on my experiments, and be the kind of mother that I wanted to be. And then, of course, the pandemic hit and we were furloughed. So all I could do was stay at home and work on some professional development or write some reviews. And I found that, first of all, I didn't miss being in the lab. And second of all, I really appreciated the extra time I had with my daughter and to be able to, completely control my own time. And I think, mental health issues and becoming a mother are two very common things that a lot of female researchers will experience. And at some point, I think you have to, unfortunately, make that decision. So then I thought to myself, okay, it's clear I have to leave. I kind of fell into editing. I spoke to a few friends who had left academia, asked them what they did. They happened to be editors, and they said, come on, this is like a rescue boat for people leaving academia. So I thought, what, let me give it a try. So I found a job at Communications Biology, which is part of the Nature portfolio, and spent a year there before joining Nature Neuroscience. And I've been very lucky that, I absolutely don't regret it, and I really enjoy being an editor. So just to explain a bit why, I do enjoy being an editor. So, the things that we do all day, every day, they're very varied. And the great thing about being an editor is you can make the role exactly how you want it to be. So obviously, I'm sure as everyone would expect, the main thing that we do is manuscript handling. So we choose whether or not to send papers out to review, and then eventually whether or not they're published based on, the priorities of the journal and also feedback from reviewers. And when we get a manuscript on our desk, we're really assessing it mostly for novelty and interest. And of course, it has to be within the scope of the journal. And then if it goes to review, when we're reviewing the review reports, we're really assessing the feasibility and the benefits of the suggestions that they make, and also their enthusiasm as well. And we're effectively acting as liaisons between the authors and reviewers. And in everything we do, we're making sure that we enforce the publisher policies, and we're offering the best possible author service. But mostly we're ensuring that the publications are high quality and transparent. We also, it's imperative to keep on top of the field, and even more so than in academia. So whilst you're in academia, you're very much on top of the field that you're working on. But when you're an editor, you have to have a very broad knowledge across neuroscience. And obviously we do this in the same way that you would do this in academia. So we read a lot of papers, we attend conferences, and we also do site visits to research institutions. But as well as attending conferences, we also organise conferences ourselves, and these can be, within journals or across the portfolio, but also external facing conferences like the Nature conferences that some of you may have seen advertised. And another thing we can do is to commission front half content. So when we're referring to front half content, this is reviews and perspectives and commentaries. And this is really basically, on anything that we find personally interesting as an editor, and we'd like to, draw attention to the fact that as a journal we're interested in this field. And similarly, we can write research highlights about absolutely anything we find interesting at all, as long as it's within, you know, the scope of the journal. There are, of course, some administrative tasks. So you help to promote the published papers. This is a service that we offer to the authors. This can be Twitter. This can be assisting with press pitches. And, you know, we also handle correspondence in with respect to refutation. So, for example, if we publish a paper and someone gets in touch with us to say, well, we think this is fundamentally flawed because X, Y, and Z, we then, you know, see through that whole process. We see if those concerns are founded, and then eventually we publish a correction if necessary. And in everything we're doing, from recruiting reviewers, commissioning authors, we do make sure that our diversity and inclusion targets are met, so that we are giving a voice to all demographics. In some journals, so where I first started, such as communications biology, we actually have external external editors as well. So these are active researchers in the field who also do editorial roles, you know, part-time. So we train them, and we train them to think like editors rather than reviewers, because there is a difference, and we assist them with finding reviewers and assessing reviewer reports. And we also have a constant ongoing discussion with them about the journal, if the scope needs to be changed, if the editorial criteria needs to be changed. So we're constantly getting feedback from researchers and interacting with them. What we don't do, so when you have a manuscript that lands on your desk, you don't tend to assess technicalities. You assess whether or not it's novel and interesting. If there is something like fundamentally flawed, or there's a big red flag technically, then we can reject on that basis. But normally what we're doing is just looking for the message. Is this useful to the community? Is this interesting? Is this new? We also don't count reviewer votes. So this may be of interest to you if you have ever received reviewer reports, and let's say, for example, 2 reviewers are really into the paper and 1 isn't. If it's still rejected, that could be that one reviewer that is against the paper has the technical expertise that allows them to identify, say, fundamental flaws that the other 2 reviewers haven't identified. So we don't just say like it's 2 against 1. We take into account the nature of the comments and the expertise of the reviewers. And the one thing we definitely don't do, even though, you know, contrary to popular belief, we don't make decisions at all based on author names or affiliations. And that's because even the best, you know, the most prominent researchers in the field can produce absolute duds. So we don't give like any preference to certain authors or certain institutions. So the transition from editorial to academia, obviously you won't have to be doing lab work, and you won't have to be designing experiments. You won't have to be constantly, you know, applying for funding, because editorial jobs are permanent. But you will still get to attend conferences, you will still get to network, and you will absolutely be keeping on top of the literature, more so than if you stayed in academia. And the great thing about being an editor is that you actually are in a position to give others a voice, and you can steer the way the field is going. You still can, you know, write as much as you want about anything you find interesting. You get to see some really cool manuscripts, also some really awful ones, but, you know, you get to see some absolutely wonderful work, and you get to be exposed to a lot of disciplines that you wouldn't have normally been exposed to. So when I started at communications biology as the neuroscience editor, because communications biology accepts submissions in all of biology, at one point I was handling a paper about the effect of spaceflight on plants. Like, I would never have read something like that if I stayed in academia. So you get to be exposed to all these cool fields that you just didn't give a thought to. And you also, you know, you stay very much on top of the research landscape, and you get to influence publication and peer review policies. And then just to finish off the kind of career prospects that you have as an editor, of course, you can move around to different journals, you can go sideways, you can go up, or you can leave and go to a different publisher. You can take on more management roles, so you can become a chief editor or executive editor. But you can also take on management roles in other aspects as well, so you can go into the commercial side, or policy, or author service. It's also very easy to then move across into other psychoms jobs, journalism and PR. You can freelance, and believe me, the money is great for freelancing, so that's not something to ignore. And you can also very easily move across into funding body panels and also research institute coordination, because this requires you to have like an overall view of the research landscape, which you get very quickly as an editor. So that was just like a very quick summary of what I do and why I did it. But of course, if anyone wants to reach out, then you can reach me at this email address, or you can contact me on Twitter, or if you want to contact any of the organisers and be directed to me, that's absolutely fine as well. So, going to figure out how to stop sharing now.
Thank you, Karli, so much. Wonderful presentation and very detailed one. I believe that all our participants learned a lot today about how to do that. But still, the question is, okay, you're in academia, you've been trained to be a hardcore academic for many years. How employable were you feeling for a career outside academia, for a career as an editor when you finished your, when you were at the end of your postdoc? And what kind of skills or experience did you have to show during that transition?
I didn't feel very employable at all. And that was completely wrong, and that was because I was institutionalized. I didn't know anything other than academia. I could only see, I had like tunnel vision. I was going to be a PI. Actually, I got awarded a small grant on the Friday. I resigned on the Monday, took the risk, got offered the job at Comms Bio on the Tuesday. So very stupid thing to do, but I'm glad I did it. So it really was, you know, I was almost there. And what I would just say to anyone thinking of leaving is just leave, because, you know, the skills that you gain in academia, they are so easily translatable. Especially becoming an editor, the knowledge that you have as a scientist, you know, some publishers don't require their editors to assess the manuscripts, but publishers like Nature and Cell, you do. You really need that in-depth knowledge to be able to assess the manuscripts. Are they actually novel? Are the reviewers suggesting something sensible? That's not something you can get from anywhere else other than being in academia, doing the experiments yourself and understanding how long is it going to take to generate these mice? Is it feasible to ask them to do this? And, you know, so that's very important as well. But there's other like soft skills as well that you learn or that you gain from spending so long in academia. Being able to juggle so many different things stands you in such good stead in editorial. And I have noticed, even like within the short time I've been there, people who have done postdocs, who have been in academia longer, who are able to juggle all those different things, find it so much easier to pick up things and do the work. And, you know, so I'm pretty sure that, of course, there are going to be people without postdocs, without PhD, who are able to do that as well. But my point is that those skills also come from that time in academia. And it's so easy to use those. You don't even like realize until you're there. And I'm sure the same applies for moving into any other profession. Once you leave, you realize all the benefits that all the skills that you've gained, all the benefits of them in the new job, and people hit the ground running. And like, they really do. Everyone I've seen who's left academia and gone into editorial or communications or, you know, something adjacent, they really do just hit the ground running. So I would say just go for it. And job opportunities come up all the time in publishing, all the time. So, yeah.
That's really inspiring to hear, because many people could be in a similar position as the one you were some time ago. So it's good to hear that. Nicola, do you want to share your perspective?
Well, I'll second what Karli has just said, is that, I mean, I haven't got the experience in sort of like a PhD or anything like that, but one thing about multitasking in industry, it's also very much like that, because the deadline turnarounds are incredibly fast, and you can be working on multiple different projects at any one time, and that means you can be doing like experiments on different projects in any one day. And believe me, fermentation of Clostridia is very time consuming. So yes, I do agree. Like, if you've been in science before, like, and the experience I've had doing research and then commercial kind of experience has really helped me in my current communications role, because for reviewing grants for projects and project reports and that, I can then understand what the scientists are trying to say and then translate it into whatever audience. So it doesn't matter if they've not got a scientific background, because I have, and I can then translate it into so I kind of like that fact that your experience does go with you.
Excellent. And just because we are coming to the end of our session, just to bring everything together, it's also good to talk to the people that are there to help you. As we saw in session 1, we have an amazing career development department and team. They are there to help you use them, use the consultants, use their experience and learn from this, so that you can translate the skills that you already have to something that can be employable to different industries.
Yeah, I have to just say, sorry, well, just before I left King's, I did use the career service, and I did speak to someone, and they made me feel so much better within half an hour. So I can vouch for that. I can vouch for it. Use them, definitely.
Great, thank you. It's good to hear that. Thank you both for joining and for sharing your career path and your experiences. And thank you to all the attendees. We will have a 1-hour lunch break now and come back at 2. Thank you all.
Thank you.
Bye.
Hi, everybody. We are here. We're back after the lunch. I hope you enjoyed your food. And we are for the session number 5, Science and Charities. So we have 2 exceptional speakers, as all of them have been, Jorge Gomez Magenti and Lorenzo de la Rica. So we're going to start with Jorge. Jorge graduated in chemistry at the University of Valencia and went to UK to do a PhD in organic chemistry at the University of Cambridge. And after some time in science innovation consulting, now he is doing responsible research impact evaluation for ARUK. He's working there communicating the value of the research that they found to the supporters, the public, and trying to make better decisions about the research that they are funding. So I'm sure that some of you have been applying for ARUK grants. So please, Jorge, tell us more about your experience and background.
Thank you, Maria Lisa. Yes, can you guys see my screen? Yes?
Yeah, we can see it now. Thanks.
So, well, hi everyone, my name is Jorge. I'm a research manager at Alzheimer's Research UK. Just in case, for those of you who might not know, ARUK is a charity that funds dementia research in the UK. And actually, we put quite a lot of emphasis on capacity building and supporting early career researchers. So if you want to know more about this and about funding opportunities for ECRs, you can contact me later and I can send you some links. And I'm going to tell you a little bit about my job and how I got here, but I need to open first thing with something that I wish someone had told me back when I was really lost at the last year of my PhD. Because this is what I used to think. You know, I only know how to make molecules and I'm not even that good at it. But over the past more than 3 years, I have worked with a fair amount of people with PhDs and with a whole lot of people without PhDs. So I can tell you as a first message that all of you in the audience, simply either by having a PhD or being close to finish it, you are in the right-hand tail of the distribution for several, if not all, of these skills. You know, planning for long horizon goals, planning things 1 year out or even longer is definitely not a natural skill. Time management skills, working under uncertainty and pressure, landscaping or putting things in perspective, critical assessment of others' work, learning new complicated things and then explaining those complicated things, and public speaking. And obviously, you might be stronger in one or two of these things, and that will very likely determine the type of job that you're curious about. And I really encourage you to think in terms of your strengths when considering a career outside of academia, because it's quite likely that the things that you are stronger at are also the things that you enjoy the most. It's not always, but it's normally the case. So how I got here, and it's funny, I did recently some timelines about early career researchers funded by ARUK, and here's an example about Dr. Gargi Banerjee, who's one of our clinical fellows, and I thought that I could just use the same template for my career, which, yeah, it's a bit shameless, and I hope you'll excuse it. So I started my PhD in 2015, and by mid to end 2018, I was like, okay, I really need to find a job. And I was not very happy at the time, and that got me to say yes to basically this first job that I applied to and the first job that I got an offer for, before even finishing the last experiments and writing my thesis, which is something that if you can avoid, I highly encourage you not to do. Better to focus on one thing at a time if it's something that you can afford. And then I started doing scientific and innovation consulting, and in that time I think I really improved how I prepare slides and how I deliver presentations to clients, and that's a skill that I also really encourage you to practice and develop, because doing good science is just a part of the story, but a really big part is also being able to convey and to show how great your science is. Then I finished the PhD, and by the end of the year, I started playing around with Excel and doing super easy and primitive-looking dashboards in Excel, and then learning data analysis in Power BI. And I think that that's what got me my current job as as a manager doing impact evaluation at Alzheimer's Research UK. So now I'm working to accelerate the discovery of new treatments, preventions, and diagnostics for dementia. And over the past almost 2 years, I have learned a whole lot of different things that seem very far removed from my time in academia, but they are also informing decisions that we make related to academic funding. I not only improved my data analysis skills, but I think more importantly, I learned frameworks that help me put my thoughts in order and help decide what type of analysis to do, how to interpret the numbers, and what to do about them. So this is how I got here, and very briefly, I want to just give you some examples of what the job actually entails. And normally I think of my job as having two purposes. First, I do work that helps fundraise, hopefully. And that's been mostly the development of an internal resource, which we call the Impact Hub, which is a repository of case studies and stats that showcase the quality of the research we have funded. So I research, write, and with the help of my colleagues, some of these case studies, and then we make these infographics that then our fundraisers can use in their presentations or in their pitches, or we can use in our annual reports and so on. And then perhaps the part of my work that I enjoy the most is work that, again, hopefully helps make decisions. And I'm about to give you some very general examples of some of the work that I've done, but if you're curious about anything, again, you can just contact me later. So for example, one of the things I've looked at is how many active dementia researchers there are in the UK and where they are based, and how this relates with the levels of funding and the levels of scientific output that are being produced in different areas of dementia research. I also did an analysis of gender disparities in the career pipelines of dementia researchers, which, by the way, we'll send for publication soon. And here you can see how the pace of change between men and women researchers is not the same for first authors, who are ECRs like yourselves, and last authors, or PIs, which shows that there's some barriers that are affecting disproportionately female ECRs. And then I have done quite a lot of landscaping work to see sort of gaps and opportunities for areas for our future research initiatives. Here you can see a bibliometric network where each cluster are researchers who work in similar areas, and the connections are the type of collaborations that they're having between them. Okay, last slide. Sort of few take-home messages, not necessarily just about working in charity, but as a transitioning outside of academia. First one is zero guilt. Like, I feel like life's too short to feeling guilty about stuff that no one else should be concerned about, and that's just your career. Make the decision that will make you happier or give you more stability, or whatever the reason may be why you are leaving or you might consider to leave academia. Second is focus on your strengths, and then remember your value. And this is a completely transactional advice, but the way I think about it is that unless we have rich parents, we all work to put food in our mouth and to pay the bills. So always just be unapologetic about seeking the compensation that you actually deserve. And then final one is that charities, I think they are, or they can be, at least most of them are, great places to work at, not only because of the higher ethos, and that's something I can tell you after doing consulting for some time, this higher purpose and these higher values is something that I really appreciate, but also charities give you more flexibility and there's a bigger emphasis on well-being. Yeah, I've been really happy at ARUK and I hope that I can stay for a long time. And that's what I wanted to tell you.
Thanks a lot. Thanks a lot, Jorge. I really loved this last slide, specifically the don't feel guilty. Thank you very much. We will go to the question and answers afterwards. And now I will introduce the second speaker of this session, Lorenzo de la Rica, who completed his PhD on epigenetics and biomedicine in Barcelona. And he moved afterwards to Queen Mary University in London with a Marie Curie. And he decided to explore other careers in the non-profit charity sectors. And he has been in different positions at the Royal Society, the BBSRC, and currently he's at Cancer Research UK. So he's a research program manager at the Cancer Grant Challenge Teams, who is a recent funding initiative by two of the largest funders of cancer research in the world. So please, Lorenzo, tell us more about your career.
Yeah, first of all, thank you very much to the organizers for inviting me today. It's always a pleasure to talk about what mistakes one has done in the past and share a bit of your own journey. So yeah, I am Lorenzo de la Rica, a research program manager within the Cancer Grant Challenges team in Cancer Research UK. And similarly to Jorge, I'm going to start sharing a bit of my career. I'm not going to spend a lot of time sharing my sort of fairly standard academic career with a bachelor, master's, PhD, and then a postdoc, which is what brought me to London. But I'm going to spend a bit more time explaining a bit of the places on which I've been working on in the last actually say six years now, which, as Jorge mentioned, actually working for the charity sector actually brings great people to work together with really great ethos and a clear mission in mind. So that's something that I've experienced in all of the workplaces that I've worked at. So I started my journey out of academia at the Royal Society as a scheme manager. So that's when I moved into science funding, because that was one of the things that I was most interested in, just understanding a bit more how funding decisions were made and how the committees would select the best science to actually take them forward for funding. I spent then almost 3 years in Cancer Research UK working in the research careers team, which is similar to what the previous speaker talked about. I was focused on supporting early career researchers, establishing their first independent research groups with fellowships both for clinicians and for non-clinical researchers. Unfortunately, then the pandemic hit, and Cancer Research UK is a massive charity, and the fundraising part of the business was quite affected by COVID. So then I had what I call like a study year in the public sector, in which I moved around quite a bit. I tried one of the research councils, the biology and biotechnology science one. I also tried the National Institute for Health Research. But I ended up returning to Cancer Research UK to work for a different team in a different, quite broad initiative that is the Cancer Grant Challenges. So I guess the fact that I've returned back to Cancer Research UK speaks volumes about what I think about the charity and how excited I am of working there. So yes, these are just some photos from fancy events and places I've been in the past. This is a completely unnecessary remark and photo about when I was invited to a royal reception for Newton Fellows at the Royal Society. This is St. James's Palace. Unfortunately, the host was Prince Andrew, which has been all over the media for the wrong reasons. So yeah, that's the only royal I've ever met in my life. So yeah, what a shame. So after this completely unnecessary remark, I'm going to talk to you about what is it that I do, and obviously to explain that I need to share where is it that I am working. So as I mentioned, I work for Cancer Research UK officially, but I'm actually working for this large international initiative, which is Cancer Grant Challenges, which is a global funding initiative funded by Cancer Research UK, which is the second biggest funder of cancer research worldwide, and the actual largest funder of cancer research in the world, which is the US National Cancer Institute, which is a federal agency that has a budget of around $6 billion, which is just amazing. So we set ambitious challenges and provide teams £20 million to basically come together, think cross-nation, cross-disciplinary, how to basically make progress against these sort of challenges. So far, we have invested £130 million, and there's like another new big investment to be announced fairly soon. So with this sort of in mind, this is where I work specifically. What is it that I do? And some hints about the day-to-day job. I am sort of the key scientific contact for some of the funded teams. You can see some examples of the challenges that we set the teams to tackle, the name of the team, and what is it that they do and where they are internationally. And my job is to be well embedded within those teams, understand how their science is progressing, review and facilitate their annual reviews, and ensure that I am in the know of when papers are going to be published, for example, so that I can connect them with our comms team, with our philanthropy or fundraising teams, in commercial partnerships, etc. So basically, I have to have that sort of helicopter view of the science and what's going on, spot potential gaps and opportunities for collaboration between teams, because in many occasions, one team is tackling a challenge that actually some of the other teams have already solved, or techniques that have already been sort of perfected in other teams. So I have to proactively work and with the teams and broker those relationships. On top of that, I support the Cancer Grant Challenges Scientific Committee to select the funding for the new teams. And this may actually seem like a dry part of the job, but it's actually one of the parts that I am most excited about, because you get to speak to prospective applicants. In this case, the applicants are actually quite high-profile group leaders, and you get to sit on the table when they are at their interviews. So basically, you get to listen the amazing science that these scientists want to do in the next 5 to 10 years if they had £20 million. And in some cases, you see that the impact that they could have in patients, it could be absolutely amazing, and that this could really change the field. So extremely exciting part of the job. I also deliver and develop Cancer Grant Challenges strategic activities to ensure that the community of early career researchers is properly supported, because this is quite a unique international program, and we need to ensure that the researchers, the future talent, the pipeline of future leaders, basically capitalizes on these unique opportunities of international science that CGC provides. And an overarching theme of my job is obviously to understand and be quite up to date on all things related to cancer research. So I get to go to very cool conferences, get to meet amazing researchers. I get to wave the Cancer Grant Challenges flag to raise awareness of the program, and obviously gather intelligence from the community about what the next challenges in cancer research will be. So with this, I would want to to wrap up about some things that helped me make the leap. And I'm not a big fan of giving sort of unsolicited advice. Take from this what you think will be helpful. But overall, I think that as the previous speaker mentioned, you need to think about what is it that you like, what is it that you want, and what you are good at, and potentially even asking for feedback from colleagues, because some of the things that you are better at, then that's going to be quite the best way, the best avenue forward in your future career. I had to talk a lot to myself and with myself regarding what is it that I wanted to do and have some hard conversations about my future. Obviously now there's a lot of information online, and one thing that I did is looking for jobs and then which ones were actually exciting me and which ones I saw myself actually being, thriving and potentially doing that. As Jorge has already mentioned, transferable skills from your PhD and postdocs. I mean, you have a whole load of basically skills that you can just transfer into jobs out of academia. So that's something extremely helpful for you to sit down and think about those skills. Then contacting people, like generally, I feel that, as I said in a few of these points, people tend to be quite happy to help. And even if it's someone you don't know, if you tell them, hey, listen, I'm looking up to your career, I would like to get to the point where you are now, people are gonna basically lose their mind to help you, because people love to talk about themselves as I am doing now to some extent. So people are quite willing to help, and I've got a lot of chats, coffees, conversations with random people that help me without anything in there for them. Obviously, attending events is key. And I would suggest also to use university career support services that helped me a lot during my transition out of academia. Obviously, all of this helped me to grow my network and as well as getting involved in activities to grow your skills. I think I've run out of time. As I've mentioned in the previous slide, feel free to contact me if so you wish, email, Twitter, or LinkedIn. And as a shameless plug, if you want to follow Cancer Grand Challenges, you have all our social media here. And yeah, so with that, happy to take questions. Thank you.
Thanks a lot. Thanks a lot, Lorenzo. Very, very interesting work. And there are several questions already in the channel. So I'm going to just read them. I also have a lot of questions myself, but I will go first with the questions of the audience. So how did you decide to leave research after your PhD or postdoc experience? And how did you choose to work for the charity sector and not industry, or not because charities is not like the typical way to go. So you can you, for example, Jorge first and after Lorenzo answer that?
Sure. So the decision was almost made for me, to be honest. My PhD was not great, and by the third year I realized that I would not be able to have a successful career in academia, such as the type of career that I had envisioned before. It's the career that we all dream, I guess, when we joined a PhD program, which, by the way, I think that's an issue with how we frame things. I think if we told PhD applicants that most of them will end up having very successful, very rewarding careers outside of academia, people would feel much happier about it. So yeah, that's the thing. And then I chose charity. I started in consulting, but then I moved to charity. Honestly, the job just sounded very good. And I didn't know what to expect of working in a charity back when I applied to one. Now I know that it's something that I wouldn't go back to my previous sort of consulting life, where this is longer hours, much more pressure. You're working to make money for someone else, like what we were discussing about how the higher values that you can work towards while working in a charity.
Great. I like the answer. And what about you, Lorenzo? How did you decide to leave?
I mean, I guess to be fair, there were two main reasons. The first one is during my postdoc, I was working with embryonic stem cells, which meant very long hours, most of the weekends having to visit the lab, and just generally, I felt that my job as a scientist was to get paid to fail, in the sense that as a scientist, 90% of the experiments you are going to do to some extent will fail, and that's completely fine. That's part of the job. And some people deal with that frustration fantastically well. I don't. So that was one reason. And the second one was that I probably was lacking that scientific curiosity to devote my whole career or life to a set of proteins or a set of pathways. And I always enjoyed more like having a helicopter view and being involved in many projects. And I feel that's what the charity sector has given me, specifically Cancer Research UK, in which you have that broader mission of, supporting beating cancer sooner. But at the same time, you actually get to use your skills from your previous scientist life. So yeah, those would be the two key reasons for me.
That's one of the questions that I had in mind about the skills. Do you feel that the skills like transferable from academia to charity sector? Did you have like many difficulties, or did you have to recycle the courses? Was it easy, the transition, or how was it?
Okay, so on that I can say that I think one of the biggest skills that PhDs and ECRs have is the ability to learn new things. And most of us who do a PhD program, I bet that most of us are the type of person who are lifelong learners anyway. So obviously then, depending on what type of career you want to have, you need to sort of shape or focus on some particular skills. In my case was around data analysis. I had never touched Excel really, except to make a couple of charts during the PhD, but then after that I started with Excel, Power BI, now I know a little bit of R. So yeah, there's a little bit of learning and sort of focusing where you want to go in your career. But that's what we all do, right? Like we are, as I said, lifelong learners, I think.
Yeah, I completely agree.
Yeah, and I would say that obviously in my case, for example, I had a clear idea that I did not want to do a master's. I didn't want to retrain or spend a year doing something else, because I felt I was equipped to, to potentially work in something else. So for me, for example, things like Excel, now I had to do a bit of Excel on finances and funding. I have been analyzing data, probably I shouldn't say this, but, like from high throughput experiments in Excel. Yes, sorry, I couldn't crack R or some other more complex tools. So obviously then, going from 400,000 cells into something a bit more easy was something easily transferable. Then as a PhD student or as a postdoc, you need to do a lot of project management and time prioritization. You need to do many things in very little time. So effectively, that's a really nice skill to have anywhere generally in life. So that was something easily transferable too. So yeah, I would say those were the two key ones that I took away from that into my new job.
Well, yeah, that's great about the skills. I was thinking also about the challenges, because you're changing from the point of view of the person that is applying for grants and for fellowships to be the person that has to take a decision about who is getting or like evaluating what's the impact and deciding. So what are the challenges of that? Do you have a team? Are you working kind of alone? Do you have someone like supporting you, or how is it?
Would you like to start, Lorenzo?
Oh, yeah, absolutely. Yeah, I mean, just to quickly say, so I don't make the decision. The decision is made by a committee of world scientific leaders that we support. We ensure that there's due diligence, that the process is fair, that there's no unconscious bias playing into the decisions they are making, etc. So we support them, inform their decision making, that the decision that it's from the advisory committee. And that what you are saying about being a researcher and asking for money, has that been a challenge because you actually go to the other side? that's actually quite an advantage, because you've been there, you have the empathy, you know what it feels to get rejected from funding. So obviously you deal with those conversations quite carefully. So yeah, basically that's the way. And regarding being alone or being within a team, we are, well, at least at CRGP, we are well integrated within a team. So it's mostly teamwork. Obviously, there are specific strands of my job that I lead on my own, such as the future leaders area or some others. But yeah, it's mostly part of a team of very nice people.
I love what you said about empathy, because I was thinking exactly the same. When you're doing the PhD, you know how hard you have it, but then in research management, you have a systems view of how difficult and ugly the system is quite often, and then you can work within your team to try to improve things. Yeah, so yeah, I really like that response.
Great. Thanks a lot, both of you. Thanks a lot, Jorge. Thanks a lot, Lorenzo. And yeah, we have to pass to the next session, the session Pharma and Biotech. But thank you very much for participating on this. So for thanks. For our next session, Pharma and Biotech, we have 3 speakers. They were so good that we couldn't decide which one. So the first one is going to be Rebecca, after Stephanie, and at the end, Sarah Gibson. And I'm going to present the first one. Rebecca did her PhD and postdoc at the University of Manchester. She was researching circadian neurobiology. And in the middle of the pandemic, she decided to move to the industry, like change completely her world. So I hope you are entering on that, because that's a hot topic. And she made a move to protein tech, and after many interviews with pharma companies, and now she's product manager and science liaison. So thanks a lot, Rebecca, and please tell us more about your job.
Hi, thank you for the kind welcome. Yeah, my name's Rebecca, and I actually have a couple of slides that I can show you guys just to sort of talk through what I'm doing currently and how I got there. So I'll just quickly share my screen if I'm allowed, which looks like I am. So, oh, sorry. So just go on and... Okay, hopefully everyone can just see the full screen. Yeah. Not perfect. Okay, yeah, so thank you for inviting me to this Alternative Careers Path event. I was approached through LinkedIn after someone had already watched one of my webinars, which was really kind of you. Thank you for thinking of me. So yeah, just briefly about myself. So I did my undergrad, MRes and PhD with the University of Manchester. I also had the opportunity during my PhD to do sort of a year's worth of work with the University of Oxford as well. And then I did a 2-year postdoc, well, a 1 and a bit year postdoc with in a different lab, but also at Manchester. So yes, a broad scientific background, but primarily I'd say I was an expert in neuroscience. And so what was my academic output? And the reason I'm saying this is because we're obviously all academics, and we want to know what is good from our output in order to then, say, progress into a different career. So say I moved into biotech, I was also looking at pharma. So my academic output was I was really fortunate to have work on many different projects that were actually really quite successful. So I was able to get 3 or 4 first author papers. I had a research secondment at Oxford, which was really great in terms of you could talk to future employers about cross collaboration, writing different grants, working on different projects, leading different things. I was also, because I did my PhD prior to the pandemic, I was able to attend many different international conferences, including having 2 speaking opportunities as well as posters. And I won various travel grants and prizes to do this. And I also organised lots of different outreach events for the public. And the reason I'm saying this is because my job is to do a lot of presentations, it's to interact with customers, it's to interact with scientists. So the way that I had to get this job is I had to spin the work that I'd done during my PhD, during my postdoc, in a way that would then present me as incredibly capable to do the job that I have now without any previous industry experience. So that's why I think mentioning all the conferences that you do, mentioning all the papers that you're on, or any kind of speaking opportunities, any kind of outreach or engagement opportunities, it's really great to tell people use your what are called transferable skills in order to write that CV and to get that job interview. So then demonstrate to people that despite not having any industry experience, you actually have probably even more experience in transferable skills and a lot more different flexibility in how you can then move to a different job. So one of the briefs I got when doing this was why did I choose my job and why did I leave academia? So as said in the introduction, I moved from academia to protein tech as part of during the pandemic, and she wants to know why. So the reason I actually did that wasn't because I thought that it was a really good idea to move in a pandemic. It was actually because, as always happens in academia, my funding ran out and my contract ran out, and I knew I didn't want to stay. So why did I know that I didn't want to stay in academia? I really enjoyed what I'd done, but my heart was not quite in it. I found academia was quite tough sometimes, often unsupported, and a lot of my work was done in vivo. I did a lot of in vivo surgeries, in vivo neurotract tracing, things like that, and I really wanted to move into sort of becoming less dependent on the in vivo and the mouse work, and that wasn't necessarily an option for me. I looked at lots of different postdocs, but I didn't have the skills to move out of that. So I decided that I wanted to use what I really enjoyed, and I really enjoyed talking to people. I really enjoyed discussing science and helping people out. So that's why I went into sort of a more pharma biotech role. And before I talk to you about my job, I just want to talk to you about some application tips that I was given, and I can sort of then provide to you guys if you're looking at applying to industry, because I applied to many different pharma jobs and many different biotech jobs, and I had a lot of what I would call informal interviews. So what this is when I spoke to some people on LinkedIn, and I'd either meet them for coffee or I'd go for a chat or talk to them on the phone, and they were in roles that I was really interested in looking at. And these are absolutely vital in order to understand the role that you're looking to move into. And they also gave me some invaluable experience in terms of when I got the interviews, when I then got the really complicated briefs for various like panel interviews, they were then able to help me. So like I say, I can't recommend LinkedIn enough. Get a good profile, start matching people that you're interested in roles that you're interested in, even if you have no contacts with them, even if you have no reason whatsoever. There are so many people out there that want to help you, especially if they've got a PhD themselves. They know it's really hard to transition, so they will be really, really willing to help you. And I also just want to say that, unfortunately, no one outside of academia cares about your niche academic background. And what I mean by this is to really tailor your CV to your transferable skills, but don't focus on how many RNA-seqs you can run in one day, or how excellent your Western blotting skills are, or how great, I don't know, your use of ImageJ is. Like all these things, they don't actually care. They just want to know about your transferable skills and why you want to move from academia to industry. You also need to have some outside the lab experience, and you can really just pick and choose anything that you've done, whether or not that's if you're part of like a dance society, or you've done Pint of Science, or you've done outreach with the university, things like that. And also do apply for the jobs, even if you only meet 1 to 2 of the like really long list of criteria. I've done a lot of hiring recently myself, and what you put on the job description is really just your wish list for the perfect candidate, but you know that that perfect candidate isn't out there. So you might find that you see someone who hasn't got a lot of the criteria that you want, but you think that they'd be a perfect fit within that company, and you'd be willing to train them. So that's a really big tip, is to just apply anyway. So what is my role currently? So I am a product manager and science liaison, which is a sort of long-worded title, but essentially I work with R&D to help launch new products. I also work in terms of that's the sort of the product manager role. In terms of the science liaison role, I actually do a lot of workshops and webinars. So I'm educating and helping scientists with their work. So helping with them with like Western blots or IHC, because we are primarily an antibody company. I also do a lot of presenting and analysing in scientific discussions, and that's either internally or externally. I do a lot of training, both internally, so when new people come in, I will train them on all our products, and I also do external training, so that's with some distributors or other people that aren't actually part of protein tech. I also really try to stay in contact with the science and the scientists. I read a lot of the papers that get published with the protein tech products. I try and contact them and try and speak with them, understand their research, understand their pain points, things like that. I'm also in charge of running lots of early career researcher events. So supporting scientists and giving them a platform to present and providing them with grant money. And just really briefly, because I'm here, I want to provide just give you an opportunity of who ProteinTech are. So ProteinTech, we are primarily an antibody and immunoassay company. Within that, we have antibodies against 13,000 human targets. But we also have our humankind range, and so these are cell HEC293 cell express proteins which have native folding. We also have our nanobody reagent as well. And so yeah, and I think I've just hit my 7-minute goal, so I'll stop sharing. And if anyone has any questions, or I'm not entirely sure of the format, but yeah, please do let me know.
Yeah.
Add me on LinkedIn, and I'm happy to help wherever I can.
Thanks a lot, Rebecca. Amazing time management. It has been very, extremely useful, and I think that I should hire you like my personal coach. So thanks a lot. We will go to the question and answers at the end of the session.
No problem.
I have to present the next speaker, Stephanie. I always have trouble pronouncing your last name, so I'm sorry in advance. Dederwerder. My Flemish is extremely bad. So Stephanie is the head of epilepsy research at UCB Pharma. She graduated from Ghent University in Belgium in the Faculty of Science, and she did a PhD working in the field of epilepsy at the Faculty of Medicine, postdoctoral research in Australia, scientist at Janssen Pharmaceutical. She was a research professor at the University of Antwerp, guest professor still inside the Faculty of Medicine, more than 60 articles in peer-reviewed journals, member of the editorial board of Epilepsia. Well, I could continue going and going and going forever, but it's better if you tell us how a successful professor decided to go to be a successful head of research, epilepsy research at UCB Pharma. Please, Stephanie, go ahead.
Thank you, Melissa, and thank you for the introduction. What I just want to share you is not so much about my achievements, but more about the story behind it, and it's just a personal testimony on all these questions and decisions we all face during our career. And it's a bit of a special career path, as Melissa was alluding to, because I've actually changed from academia to industry, back to academia, back to industry. So really a dual career path. And how things really actually started. A disclosure first. So I'm a full-time employee of UCB Pharma, but what I'm sharing here are my own opinions. So how it started was a university degree in biology and a keen interest in, how things work in physiology, disease, but then actually more particularly the brain. I thought the brain is just an amazing organ, and really wanted to know more about it. When I was studying in Ghent in Belgium at university, there was not really a neuroscience department yet, so that was actually my first hurdle. And so with some discussions and negotiations, I actually found somebody who wanted to adopt me in the medicine department, in the neurology department. So that's where I went for doing a thesis, and actually that was on epilepsy, and that kind of stayed a red thread during my career. And I think that is, for me, been helpful to build on some expertise and to be able to hold on to it because no matter the job changes, I had something that I could bring in that new position. So after the kind of graduate education in biology, the next thing was a PhD, which is kind of typical in the academic career track. And as I was very interested in the brain, this is really where I continued. So it was a 4-year PhD. I would say a quite typical trajectory, but then of course while you're doing the PhD you start to think what will be next for me, and here I really was envisaging a typical academic career. I liked one of the previous speakers who said that, you know, it's kind of our bias when you're doing your PhD that is only an academic career, but I hope to demonstrate that this is not the case. But myself as well, I was stuck in that mindset, and so I thought, okay, well, now I do a postdoc and I'll move abroad because that will be good for my mobility and also to learn more, you know, how things run in other countries and other labs. And for me, what helped was to network at conferences and talk to other PIs and try to see if they were looking for postdocs. And that's actually how I and how I ended up in Australia. I stayed there for around 3 years in 2 different postdocs. I think that was also the nice thing that in my initial postdoc in Melbourne, I got in touch with a collaborating group in Sydney, and then actually kind of naturally flowed into the second postdoc over there. But I think this was, you know, PhD, postdoc, that's kind of still the quite natural flow in the academic career. Then it's more about, okay, the tougher question about what's next. Another postdoc, am I going to do something different? And I think as for many of you, the academic career is quite uncertain. I did apply for a grant for a postdoc back in Belgium because also, you know, I was thinking together with my husband of raising a family and to go back to my country in order to be closer to family. So that kind of already locked in the country. Then what I did is actually try to create opportunities for myself, so create different choices, and so applied for a postdoc program, but also there was at the funding agency, they were looking for advisors, so I enrolled into the application process there. And then what I've done also, and I would recommend you, is actually I also networked a bit within industry. So I had shared just on a free basis, just spontaneously, my CV in a group where I thought, okay, I could bring some skills there to that group, which was an imaging group in Janssen Pharmaceutica. So I mean, without any expectations, but actually what happened is that in that final year of my postdoc, I got called by the lab in Janssen that actually happened to seen my CV, and they said that they had a position for me there. So initially I thought, well, I'm already working on 2 trajectories. I don't need a third option. But then, and also I was biased, I must say, biased about industry and, you know, that this is, yeah, that's not interesting, the research they're doing in industry and so on. But they convinced me to come and have a look, and I think that's maybe one skill is, or one not a skill, but more a personality trait, is the curiosity about new things, and you know, and then this curiosity drove me to see and have a look, and actually then being flexible and being willing to change your mind about maybe initial opinions, then actually I decided to take the job in industry as a research scientist, while it seemed that also my other 2 applications were successful. So suddenly from no options, I had 3 options to choose from, which is of course a luxury position, but still it's quite difficult then to make the choice. So I think, and also I think my story tells that, you know, even moving into industry after my postdoc, actually, and I had very steep learning curve. It was a really nice experience, great colleagues, and I learned really so much. but somehow this idea of this academic career came back into my mind, and there was an opportunity at University of Antwerp to enroll into a track record, a tenure track position. That was quite new at the time in Antwerp, and they were looking for talented scientists and PIs to start their own lab. So that was again this dream that maybe apply for that position, and that's when I started my own research group at University of Antwerp in epilepsy research, and again, I think that was also a very big learning because you kind of, as a PI, you need to be self-sufficient. You get your own funding. You recruit your own students, you set your own research direction, which is really rewarding and fun. But also it can be quite challenging in certain research climates where, and it's a big responsibility as well, because all the people in your lab are depending on you for getting grants and paying salaries. So it's quite challenging, I think. And I wanted to show this picture. It's maybe difficult to read, but actually it's a little poem in Dutch, and this is the wall of my building. And the building, I was walking every day for 6 years from the parking lot to the building, and initially I only saw these wires. So it's these. But actually, one day when I arrived at the right moment, when kind of everything, you know, the sun was in the right spot, I was walking in the right path, I saw the poem, which I never saw before. So that's what I wanted to say. Sometimes in the career, it's also about having the being there at the right moment, and that's actually how I moved into my last and current position as a head of epilepsy research, where you know, I'm leading the group there, and for me it's a unique opportunity because this allows me to build on my expertise, my knowledge in epilepsy, to continue to do research, but actually to be in an environment where there is instant valorization of the science. So our aim is really to develop transformational treatments for patients, and that was really what attracted me to the position. Why I'm saying it's that being the right person at the right time is that they had some changes in the organization, and were looking for a new head of epilepsy. And you know, then if that, you know, then that actually, that for me, I wasn't really looking for a new job, so I would say it arrived on my path, and because I kept having connections with different industries, that's how I actually landed there. So that is my personal story. So I hope you know, it's not only about achievements, but also about preservation and being open for new opportunities on your way.
Thanks a lot, Stephanie. Thank you. It was very, very useful, and we'll come back to all of that during the question and answers part. I hope we have time because we are like running super late, but everything is so exciting that I couldn't like stop. So now we're going to introduce for pharma to biotech. So I'm sure that a lot of you love open source things, and you are wondering all the time who is behind these open source programs, like algorithms that they make our lives easier. So I have here Sarah Gibson, we have here, that is an open source infrastructure engineer and at 2A2C, an open source contributor and advocate, because you have to be. So she has a lot of experience in research engineer at the National Institute for Data Science and Artificial Intelligence, and she is one of the core contributors in open source projects that you should know, like Binder, Jupyter Hub, and Turning Way. So Sarah, it seems that you hold a fellowship with the Software Sustainability Institute, and yeah, you're an advocate for best software practice in research. So please tell us about your job.
Absolutely. Thank you very much for that introduction. And we'll just
quickly. I think it wants me to give it actions, so that's a shame. Okay, I'll do this without slides for now. We could see the slides.
You could see them?
Yeah.
Oh,
it was a bit slow, but at the end, yeah, they are there now.
Perfect. Thank you so much. Perfect. I got a box that was like asking for permissions, so I thought it wasn't going to work, but that's wonderful. Okay. So hi, yes, thank you very much for that introduction. I'm Sarah Gibson, and as has already been mentioned, I'm currently an open source infrastructure engineer at 2I2C, which is the International Interactive Computing Collaboration. I'm formerly a research software engineer at the Alan Turing Institute, which is the UK's National Institute for Data Science and Artificial Intelligence. I'm an open source contributor to all of the projects that we've mentioned already, and I am a Software Sustainability Institute Fellow as well. So I'm just going to briefly talk about how I came about collecting all of these different titles and what my career path looked like. Here it is. Here is my career path. It was in no means a straight line whatsoever. But yeah, it started back in 2018 when I completed my PhD in astrophysics at the University of Leicester. I'd been working on a NASA mission called SWIFT, studying gamma ray bursts, and I was building Monte Carlo. I was building computational models in Python and using Monte Carlo Bayesian inference to match these. And it came to the end of my PhD, and I think, as many people will feel, your heart is just no longer in it. It's already been said once in this session, and I'm sure it's been said before in previous sessions as well. The drive is no longer there. I was looking at a few postdocs, but I just wasn't motivated to write my research statements. And I'd been to a few job fairs, and everybody tells you, oh, you've got a PhD in physics, you're already a data scientist. Apply for data scientist jobs. But I was also a bit like, well, I don't want just any data scientist job. I'm not going to get along in a company where I'm just like fattening somebody's bottom line. So I was in a bit of an existential crisis of, what do I want to do? Please, somebody pay me, but give me work that I actually care about doing as well. And I was very lucky in that my friend forwarded me the application to join the Turing, originally as a data scientist. And this opened up a whole new realm. The Turing has a very large network, including 13 universities across the UK and lots of partners in industry and the third sector, public and charity sector as well. So that gave me the opportunity to really lay the technical foundation for the rest of my career path. I worked across a variety of different research projects across a range of domains, and I learned all the core tools that I needed to succeed in research engineering. And I was exposed to a lot of new tools and methodologies as well. And what this really taught me was, what am I interested in? What am I not interested in? So it really was a very privileged position for me to gain that job. I'm going to talk a little bit about one of the first projects I was put on, which was the Turing Way. When this project was launched, it was a guide to reproducible research. It has now expanded to be a guide for ethical, collaborative, open research in general. But I was part of the core team that originally launched it. And I was really excited to join this project because I was like, oh my God, a guide to reproducible research. This is going to teach me all the skills I need to know to do my brand new job well. And Kirsty Whitaker, the PI, was just like, yeah, no, I want you to do all of this cloud infrastructure-based work and link up with Project Binder and deploy a Binder hub at the Turing. And what that experience was then a huge learning curve. And I learned all kinds of technologies like Docker and Kubernetes and Helm and cloud things. And I began working with the Binder team. And when we launched the Turing Way and my time officially on the project ended, I was asked to join the operating team for mybinder.org, which is the
free and public service we run. So that was like my introduction to open source. That got me hooked into all of these external communities beyond just my beyond just the team I was working with at the Turing, and that led to sort of a redefinition of my identity for me. I changed my job title to become research software engineer because that was more aligned with the skills I wanted to learn and the projects I enjoyed doing compared to data science. And I successfully applied to the SSI's fellowship program to advocate for the skills that the Turing Way was advocating for, that Binder was trying to make possible technologically. And yeah, I still do that today. I still run lots of Binder workshops as well. So this kind of like period really, it's really defined by me coming into my own. And then I just want to acknowledge that there's a little roadblock here on this. I just want to acknowledge that we're in a global pandemic that has so far lasted for 2 years, and it's okay if career development wasn't your top priority during this. So I was awarded my fellowship just before the pandemic hit, so I haven't really made good on that yet, but ASSI have been great at extending deadlines and things. And yeah, we were all just focused on getting by. But then at the end of 2020, early 2021, this new job came up through for to I2C. This was founded by members of the Jupyter Hub and Binder teams. So these were people already in my network. And while I wasn't specifically headhunted for the role, the job ad was being shared amongst people that I worked very closely with. And it was one of those cases where you read a job ad and you're like, oh my God, they've written this about me. This is perfect. Like, I don't think... Like, this is just the perfect role for me at this time, and I'm incredibly lucky to be here. So what do? At 2I2C, we provide robust, scalable, reliable, data science-ready environments in the cloud to people all around the world, and we use open source technology as much as possible. I just want to say very quickly that my path looks really orderly in retrospect, but at the time I was laying track as quickly I was moving forward. This definitely wasn't planned. Also, the version of Sarah that started back in 2018 would be really intimidated by who I am now, and a lot of growth happened, and it was because I was on this pathway that had options and wasn't fixed that I was able to do that as well. So very less takeaways. It's okay if your career path isn't a straight line. Leaving academia doesn't mean leaving research. I've been very close to researchers even though I've been in industry. You've heard it before. You have transferable skills. They are valuable. And think about your peers when networking. Who could be in a position to offer you a job in like 3, 5, 10 years time, not just right now. Thank you very much.
Thanks a lot. Thanks a lot, Sarah. I'm happy to see that other people's careers look also like a weird path, and it's not only mine. That usually we have that feeling. We are running slightly late on time, so I will just ask a super quick question, because there are a lot of people asking if it was difficult to come back to academia after leaving or after working in industry for a while. I suppose that goes to Stephanie, although there are like a lot of questions for the other speakers also, but I'm sorry for running late on time.
And people can also contact me, or I mean, I guess also I speak for the others, you know, for the questions, so that's fine. I'll be brief on that. So yes, it was difficult to come back after academia, well, after industry, because the difficulty is that you're not anymore in the network, you're a bit out of it, and the network is super important to get grants and to build. But I would say nothing is impossible, and even difficult situations can work.
Thanks a lot. Thanks a lot for this bitter and sweet advice. And well, thanks a lot, Rebecca. Thanks a lot, Stephanie. And thanks a lot, Sarah, for this wonderful session and for participating on it. So I finished this session and I will go the lead to the next one. Thanks a lot.
No problem. Please feel free to add me on LinkedIn if you have any questions that we haven't got around to answering. My name's Rebecca Northeast. Bye.
Thank you all. And now we are moving on to session number 7, and that's the session about education. As you can see from the title, it's a special session since both our speakers are still in academia. We want to highlight that in academia we don't just have the research-only route. Lately, universities are supporting a teaching-focused contracts and teaching-focused routes, and this is what both our speakers represent. And I'm delighted to welcome Dr. Brenda Williams and Dr. Evgenia Kravariti. We are delighted to have them speak in our event. We will start with Brenda. Brenda is the lead for the MSc in Psychology and Neuroscience of Mental Health here at the IoPPN, and she's the deputy lead of the Department of Education in the Department of Basic and Clinical Neuroscience. She has an impressive CV, started her PhD in neurobiology from UCL, and then did her postdoctoral research positions at Cancer Research UK, the National Institute of Medical Research, and the Dana-Farber Cancer Institute. She worked as principal investigator at UCL and at the IoPPN, and then decided to move on to the academic education pathway, and she will talk us about her transition. Brenda?
Hi, yes. Hello. Thank you, Despina. Thank you for the lovely introduction and for inviting me. I'm going to see if I can share my slides and hope all goes well.
Thank you for joining us.
Can you see them?
Yes, now we can see them.
Now you can see them. Excellent. I can't see the chat or anything now, so I always feel blind. So again, thank you for the invite. And I'm going to tell you briefly today about my pathway to a career in education. And I think Despina has very kindly gone through my first slides. I'm not going to spend very long on this. I had a very traditional, I guess, introduction to academia, from my PhD to postdoctoral positions, and then to a lab head. And it was really, I guess, being in the right place at the right time, and that was said by a previous speaker. I was offered the possibility of developing distance learning programs for the IoPPN, and that really, I guess, was a catalyst for my move to an education-focused career. And from there, I moved to the academic education pathway, and now I'm a reader in neuroscience education. And today, I just wanted to take the chance to kind of talk to you about how I stepped away from research into an education-focused career. Now, anybody that's working in research at the moment will know that when you run a research group, you do many other things as well. Here's just a list of some that I did. I had a number of teaching-facing, I guess, activities, from supervision to teaching, and a number of behind-the-scenes activities as well, when I supported our new PhD students and also tried to implement a good environment for our postdoctoral researchers as well. And I think through all of that, what I really found was I wanted to know more about education practice. I wanted to, if you will, understand the science of education. And I decided at that point to actually do a postgraduate certificate in academic practice to really consolidate what I knew about education. And that led me to be a fellow of the Higher Education Academy. And I need to be honest that at this time as well, I think I was really kind of losing the drive to continuously write grants to support the research career. And I found that all these education activities really had a great personal fulfillment. I actually loved developing teaching materials and interacting with students. And it was a real pleasure to see my students succeed, become independent, and have successful careers of their own. But I also enjoyed working with faculty to better support our students and postdocs. But what really sat with me at this time was I actually wanted to develop an opportunity to attract more people into neuroscience. And I guess what happened next was rather, I guess, serendipitous. things changed at the Institute and a new position was created for a Dean of Education. And that Dean of Education was Professor Susan Lee, our first Dean of Education. And Susan really championed education. And in coming to the IoPPN, she brought together groups of people who were really interested in the practice of education. So I was exposed to a variety of perspectives and ideas around education. And also, as she knew I was interested, she actually supported me in gaining a new role as assessment and feedback lead for the IoPPN. And I actually still do that role today. And to be honest, I think at that point, I'd really made the decision that where I wanted to go was into a career in education. And if something hadn't happened at that point, I probably would have left KCL and looked for opportunities elsewhere. But something did happen. And this again is about being in the right place at the right time. KCL decided to develop a distance learning portfolio. And Susan approached me to take on a new teaching-focused contract to actually develop a distance learning program in neuroscience. That actually didn't go to plan, because at that time we got a new principal, Professor Ed Byrne, now Sir Ed Byrne, and he really had the vision of expanding online education and blended education at KCL. And with him came a new remit, and we were asked to develop the flagship online program for KCL that brought together the best of the IoPPN, and this was a psychology and neuroscience of mental health program. Through developing that, I actually got to develop my leadership and management skills, because I had to deal with a load of stakeholders, as well as our academics and our education support team. Also Pearson's Education that were brought on board to help deliver these online programs. And a whole group of graphic designers, VLE technicians and audiovisual experts. I'm pleased to say that program was a success, and off the back of that I actually managed to go back to my first love, which is developing an online program in neuroscience, and that's our Applied Neuroscience Masters program, and that went live in 2017 and is also a big success. But although I was on a teaching focused contract, there was no pathway forward for me at that point, not until the academic education pathway was developed at King's. And this grew out of the King's strategic vision for 2029 with a statement that they wanted to value education and research equally as twin paths of the academic mission. And so the academic education pathway was a specialist education contract that not only focused on people who wanted to deliver education, but also had an interest in education scholarship and leadership in education. Now, this is exactly what I wanted. So I was lucky enough to apply and move onto the AAP in 2018. And in line with that, I also applied to become a senior fellow of the HEA, which I was also granted. And that, in a way, provided acknowledgement of my work and commitment to learning, to teaching, and also to student satisfaction and supporting my colleagues in these areas. And from there, like I told you at the beginning, I'm now a reader in neuroscience education. But I haven't left research behind. Now my research has just taken on a very different focus, that of education research. And if I just finish by thinking about the impact of this change, well, it's given me what I want. It's enabled me to grow as an educator and have a voice for educational things that happen both at the faculty level and the college level. But I think more importantly, it enabled me to achieve one of my goals, and that is of inclusive education. We have now created online programs that embed neuroscience, and this has attracted students from all over the world, students who otherwise wouldn't have been able to come to King's to learn about neuroscience, psychology or mental health. And so this has also, I think, enabled me to kind of add a richness to the student body at KCL. I think I'll leave it there because I probably used up my time. So thank you for listening.
Thank you, Brenda, for the amazing presentation. I'll quickly move to Jenny, and then all of us will come back for the Q&A session. Just a brief introduction. Dr. Evgenia Kravariti is the program leader for the MSc in Mental Health Sciences here at the IoPPN. And she is a reader in the cognitive neuropsychology at the Department of Psychosis Studies. and she has a really broad research interest, and she has helped to set up a number of faculty-wide educational initiatives for both students and ECRs, including the volunteer electronic help desk for research methods and statistics, and the recently launched faculty-wide teaching and learning support scheme for early career staff. Jenny?
Yes, can you see and hear me?
We can, yes, we can see you, hear you, and now we can also see your screen.
Okay, lovely.
And you're ready to go?
Yes. Okay, great. So thank you so much, Despina, for your introduction, for your kind introduction. It is indeed a great pleasure to be here today. And it's always a pleasure to hear my name being pronounced correctly. So thank you very much. So just to introduce myself, I am a reader in cognitive neuropsychology at the Department of Psychosis Studies. And I also need to say that I do not know if there are many colleagues who can claim almost an entire education and career path within King's. But I obtained my MSc at King's in 1996. I hope my slides are moving as I move them. And also I obtained my PhD at King's in 2001, and I have remained at King's ever since, first employed as a postdoc and subsequently as faculty. Now my transition from a research focused to an education focused career path happened gradually. Pivotal moments in this transition were, first of all, my invitation in 2006 to apply for a post as a lecturer in the MSc Mental Health Studies, and this post had a contractual arrangement that was very balanced between research and teaching, so 50% research and 50% teaching. So that happened in 2006, and the teaching was very much linked to the MSc Mental Health Studies. The next pivotal moment came when I was invited by the deputy head of department to lead and redevelop the flagship MSc Psychiatric Research in 2013. Now, if I am honest, I did not jump at the opportunity. My main concern at the time was the implications for my research activity and outputs. At the time, it took me several days to accept, to lead and redevelop the MSc Psychiatric Research. I finally accepted rather reluctantly, and the factor that weighed quite heavily in my decision was the enhanced prospects that I could see for promotion based on educational leadership combined with research. This is what actually happened, and I was next invited to lead the much larger and much more challenging MSc in Mental Health Studies in 2016. The past 6 years have signified a definite transition to a career that can be defined in practical terms as primarily focused on educational leadership. And this leadership was enhanced recently, was enriched recently by the addition of another role to my profile, which is that of the school education co-lead in the School of Academic Psychiatry. So this over the past 2 years. Now I think it's quite important to clarify and emphasize that my transition was not contractual. So my last promotion to reader was done through the standard research and education route. That was my promotion a couple of years ago. However, in practice, I would say that the significant majority of my working hours have been invested over the past 6 years in educational leadership, in management, administration, and teaching. So this balanced view of my roles in research and education is actually the hypothetical reality in my contract, but in practice, so my work life looks more like this, with a much more significant focus on educational leadership, teaching, administration, and management. So in terms of the pros that I perceive in this long and gradual transition to a education focused career. So first of all, and I think this is something that Brenda also mentioned, there is less pressure for research grants. There is also a higher perceived but not necessarily real job security. An example that I can give is that I have seen 2 rounds of redundancies at the IoPPN over the years. In the second round, program leads were excluded from the risk lists. Of course, there is no guarantee this will happen next time. One aspect of my education-focused career is the rewarding aspects of the role in terms of student contact. It can be immensely rewarding to have regular contact with students. Also, the opportunity to develop and exercise leadership, decision making, and make a difference, which usually is faster than research translates into benefits for society, is very rewarding. I found in my last promotion application that outstanding achievements in higher education may balance out research performance indicators in applications for promotion through the research and education route, but up to a point. Right now I estimate that for my next application for promotion, I may have to seriously consider a transfer to the academic education pathway, which Brenda mentioned. So this flexibility and this opportunity and option to transfer to the academic education pathway is one of the pros that I perceive. So having a background of educational leadership, there might be more opportunities for me to transfer to the academic education pathway, should I be interested in this in the future. In terms of making a difference, what springs in mind is the faculty-wide mentoring, teaching and learning support scheme for early career staff, which supports postdocs to develop their higher education practice and apply for higher education academy recognition, which I developed in 2017 as a program-level scheme, and now it has evolved into a faculty-wide implementation. And also the faculty-wide volunteer electronic help desk for research methods and statistics, which is a peer-led, staff-assisted electronic platform for providing learning support in statistics and research methods. So finally, just to comment briefly at the cons of my focus on education and educational leadership. If I'm honest again, I miss research. I'm still research active, but my research activity at the moment, in the last few years, feels more like a teaser because it is squeezed into a corner. I have found, and this is an individual experience that may apply to no one else, that the life of a busy program leader and school education co-lead can be, and usually is, busier than the life of a busy researcher, with implications for workload and burnout. Leading a large PGT course can be quite stressful. I find that my work life involves regular unpredictabilities, firefighting and problem solving. And strictly in my case again, my hybrid career pathway, which largely lacks research grants but has strong education leadership, has been rather slow evolving. I know of colleagues who became professors at the ages of 35, 40. It's been a few years since I was 35 or 40 and I'm still not a professor. So thank you very much for listening, and I'll be very happy to take any questions.
Thank you, Jenny. Great presentation. And just for the sake of time, because we have 6 minutes till the end of our session, I'll start with a question targeted mainly to you, but Brenda can also answer, and mainly to you because you are closer to where an ECR will be, and maybe you can help us better understand what were the initial challenges when you first decided to make this move and this transition. Were teaching credentials necessary or not, and where did you get those?
Like Brenda, I completed the postgraduate certificate for academic practice. This PG CAP, which I completed a few years back, was a requirement for new lecturers. So it came along with my taking up this new post as a lecturer, and I had to complete during my probation period or shortly after, but it was a requirement. Now, based on the achievements in educational terrain and leadership, I also applied for senior fellowship with the Higher Education Academy, like Brenda, and I obtained that. And now I'm supporting postdocs also to acquire Higher Education Academy recognition through the mentoring, learning and teaching support scheme for early career staff, which also involves Brenda. She is in the panel and the implementation and oversight committee. So we are both supporting this important scheme, which is now developing and opening its wings in terms of faculty-wide implementation.
Excellent. Brenda, can we also have your perspective? Sorry, Brenda, you're muted.
I'm muted, of course I am. You think I'd learn, wouldn't you? I think it is important to get, I guess, some sort of recognition for your teaching, because like I said, as well as it being something you can take elsewhere, it shows your commitment to teaching practice. So, if you are interested, you can reach out to King's Academy, which will help, and with Jenny's scheme as well, to help you become a fellow or even associate fellow as a first step of the Higher Education Authority. If you are thinking of going into an education pathway, I think this is recognised nationally as a kind of, I guess, a tick box saying, you are committed to this, and you have shown that you have carried out certain, I guess, kind of teaching activities or interventions that have been shown to be worthwhile. You can do it now in your time at KCL. I would say a caveat is, please get the support of your head of lab. But, come and talk to Jenny or, and myself. Talk to King's Academy. I think that's important.
this really leads into my next question. We heard in session 1 today that Concorda allows us researchers, early career staff to have 10 days of development, of personal development. Has the education team brought together a package that researcher can use and fill these 10 days or 70 hours of personal development and target them towards education? Can this packet be split into smaller pieces so they can use those 20 hours out of the whole 70 or something like that?
Oh, is it a package? I'm not sure. Are there activities and workshops? Absolutely. So what I would do is I would first go and see what King's Academy offer and see if it links to what you want to do as a cohort for continual professional development around education, of course. If you take a look and you find there's something there that's missing, then I think it's really important to feed it back to Jenny and I. We can talk to Juliet, we can talk to King's Academy as well, to say there's something missing from what you're offering. And it's something that our postdocs would really value. So I think there is a dialogue. There's always a continued dialogue around these things, as you're all aware. I don't think we've got it quite right. I think a package would be wonderful, except to say that what different people might want different things from a package too, so you do want to build in that flexibility. Jenny, I don't know if you have anything to add to that, anything that I...
No, I think you gave a really comprehensive response, Brenda, and I couldn't agree more. What comes to mind is that in terms of developing higher education practice, it might be possible to focus the package on specific educational or learning support activities that are focused on specific modules, specific activities, specific mentors, and perhaps instead of having a single continuous path within a specific context or frame of higher education practice, you can mix and match smaller elements from different activities, different learning support packages, different mentors. So I'm sure there are ways to develop the idea into something that can be implemented and be of benefit. What we need, I suppose, is the ideas, the enthusiasm, and the candidates to join our innovation or ideas or piloting implementation.
Excellent. Thank you both so much. I'm sure we will find the candidates to help with the implementation. It's good that we have both of you interested and invested in this idea and in supporting education. Thank you so much for joining. We have to move to our next session. Amazing presentations. Thank you very, very much.
Thank you, Despin. And please do reach out. We're happy to meet with you afterwards to talk about this further, or email us.
Thank you. Thank you both.
Thank you. Bye.
Bye.
Okay. Hello. Right. So I'm Mateusz, and I would like, it's my great pleasure to chair the next last session on consulting and industry. We welcome now Dr. Michelle Edie, who studied her physiological sciences at the University of Oxford, followed by over 3 years at Pfizer as a senior associate scientist. Then she decided to come back to academia and complete a PhD, followed by her first postdoc at University of Manchester. And after that, she has done her second postdoc at King's IoPPN. Then after King's, she has joined the LGC first as a program manager and then as a senior program manager, where she works currently helping to advance research funding management for biomedical sector. So welcome, Michelle.
Hello, thank you for the introduction. If I can just get my slides up. Right, so hopefully you can all see that. So as Matesh said, I'm now working in research funding at the NIHR as a senior program manager, and this is within the innovation programs and IP group. So for those of you who haven't heard of the NIHR, our mission is to improve the health and wealth of the nation through research. So we're actually the largest funder of health and care research in the UK, and every year more than 1 million people take part in NIHR supported research. And we invest over $1 billion per year in research. A lot of this is in infrastructure, so biomedical research centres, for instance. But I work in research programmes, of which we have broadly 9 funding streams, of which the innovations programmes are one of them. So yes, this is my route to get here. So as you said, I started doing undergrad physiological sciences. I then moved into industry. I worked at Pfizer for a few years, and then sadly they closed down the site in Sandwich. But I was already sort of considering going back to do a PhD at this time, and they did support me to do a PhD, and then I did a couple of postdocs. But I found it's getting more and more focused in sort of niche areas of science and getting frustrated with early research. And I really sort of thrive on being productive and at the end of the day actually seeing what I've been able to achieve and the impact of that. So I started to ask around, talk to various people, and one of the good things at King's is that there are opportunities to get involved in other things outside of your research. So I joined the postdoc committee, and that actually gave me the opportunity to get involved in some sort of different things and also develop other translatable skills. So a lot of things you sort of do develop within postdocs and PhDs, but we were sort of listening to what people wanted. We were trying to influence people for change. All those sorts of things ended up giving me good examples to then apply to a job in a slightly different field. And one of the people I spoke to at King's was in the supporting with grant applications, and they previously worked at Wellcome and we're talking about funding, and that just sort of ticked all the boxes for me. So you're still involved in science, seemed to be a fairly varied job, but you weren't doing the specific research yourself. So from that I applied to the NIHR. With the sort of sideways move, there was a salary cut, but I knew there was opportunity to then progress up. And actually, as much as I thought I'd missed the lab, I haven't really done so far. So I don't have any regrets in moving across and making the transition. And after a year or so, I was then promoted to senior program manager. And in fact, a couple of months into that, my line manager left and ended up leading on the AI in Health and Care Award. So there's been some good opportunities for me at NIHR, and I'm still very much enjoying where I am. So what's actually involved in research funding? I guess I came into it a little bit naively and sort of thought, oh, I've helped write some grant applications, I know what's involved. Turns out there's quite a lot more going on in the background. So one of the things that I looked for in a job, and that I definitely find in this one, is the work is very varied. You know, every day's different, as they say. So I've just got a few different sort of things we're involved in. So the commissioning of research. So this can involve scoping themed calls. So we've got one on dementia going on at the moment, which involves speaking to the experts, working out if there are any specific research questions that need to be addressed, that we need to ask our applicants to apply for. We also set up our expert funding panels to review applications, so we need to look through, see who's working in this area, speak to the people. Because our applications are at the later stage of research, we really want experts on our panel who cover the academic, technical aspects of proposals we receive, the clinical aspects and the implementation into the NHS, as well as entrepreneurial, because for our funding streams we expect our applicants to look to commercialising and how sustainable their products are. So just to take a step back, the funding stream I manage looks at medtech, in vitro diagnostics, digital technologies, that sort of thing. So we'll speak to experts in the field, see if they're interested in joining our panel. Hope they also don't want to apply to our funding stream, because then that makes them conflicted and it gets a bit confusing. But then when we have a funding programme that launches, we'll have helped design the application forms, design the guidance. We'll probably have webinars to tell people about our funding call, have Q&A sessions where they can ask us. We can try and help with tips and tricks to help write a good grant application. And then when the applications do come in, we also support the review process. So you're still quite involved in the research. You get to see these new proposals that are coming in, and you then attend the funding panel meetings and provide the feedback from our panels to the applicants afterwards. And then once the projects are recommended for funding, we then go on and manage the due diligence and contracting stage. And then once they're actually live, we then go on to monitoring the projects. So projects will be set up with set milestones across the duration. We'll attend regular project meetings with the teams. They'll submit progress reports to us, which we'll review. We'll check they're hitting the milestones that were laid out at the start of the project. If they're not, we're very aware that science rarely follows the plan, so we work with our award holders to work out if things have to be adjusted going forwards. And then we also like to demonstrate the impact of our awards, so during the projects and at the end particularly, and in fact for up to 5 years after, if any of you have been involved in Research Fish, you'll know, we continue to collect metrics, so publications, any input into policy, getting through regulatory stage gates, getting to market, sales, that sort of thing, and write up case studies to display the work we do. We also still get to go to conferences, so starting to get back to in-person ones, but this is either to present our funding streams or talk about healthcare funding out there, but also sort of keeping abreast of what's going on, what policymakers are talking about, what upcoming priorities are likely to be. And also it's a good opportunity to network with potential applicants. Sometimes we have clinics where they can drop in and ask us a question, ask about our funding streams, which one's best for them, and also often listen to the talks by experts and then invite them to join our funding panels if necessary. So the commissioning and monitoring is the bulk of our work, but we can get any number of ad hoc requests. So the funding for our projects comes from the Department of Health and Social Care. So sometimes we do get requests from government, how many projects are we funding on AI that are led by SMEs in the UK? that sort of thing. What are we doing in this space? What have we funded over this time? And there's generally quite a rapid turnaround to get back to them with that information. Also, we, along with UKRI, managed all the applications for research into COVID-19. So typically our funding calls can last for, say, 9 months from when the call opens through the initial sort of shortlisting stage, through the fuller second stage if you're invited back, and then announcing you've received funding. So that can be sort of about 9 months. However, with COVID, obviously there was high demand. It was a priority to get things turned around quickly, so we had to find a way to go from receiving application to outcome in just a few weeks. So that was quite a busy time for us, and also all the experts we got on board to review the applications. But yes, there's any number of requests that do come in. So I'm actually going to stop there. Hopefully I've given you a bit of flavour of what we do in research funding and some of the things I like about it. Thank you.
Amazing. Thank you very much, Michelle. That was very, very informative. So there are no questions in the Q&A chat at the moment, but I have several of my own. And I have also a question about how does, in those workplaces you've been, how does the career progression looking like? In what I'm especially asking, like, how long does it take for like achieving like the next bar, the next step? We know that in academia, there are like not many bars actually to achieve. There are only that many positions and steps up. And how is this in, for example, in your work environment, Michelle?
Yes, so as I said, I did sort of come in fairly bottom and got to move up to the next rung reasonably quickly. I think it depends on who you work for. So obviously different funders will have different structures in place. In terms of me, there's a few sort of rungs within senior program manager, so you can sort of informally progress up through those lead programs, that sort of thing. However, the next step above that is assistant director. So yeah, it does kind of get narrow quite quickly. I did move between teams when I went from program manager to senior program manager, and I moved into a sort of larger team that's involved in a lot more other things. So there's definite scope for kind of progression and keeping things interesting. And also, as I said, my team not only covers innovations programs, but also intellectual property. So there's a lot of option for sideways move if you want to. So, you could move into the IP team and deal more with that side of things as well. So yes, not too many rungs to go up, but within the level I'm at, there are quite a few different opportunities and you can progress through that.
Right. We're running out of time. So thank you very much to both of you. That was absolutely amazing. I learned a lot. And this was our last session. So I think I will give a stage to Despoina now. Thank you very much.
Thank you.
Thank you.
Thank you, Mateus. Many thanks to all of you that have joined. It's the end of our event. Hope you enjoyed it and you learned as much as we did today. And please send your feedback, use our feedback form so that we can better plan our next event and get feedback for what you will want to see for next time. Thank you all. Have a nice evening. Bye.